I hereby call the Brockton City Council Finance Committee for October 5th, 2020, 7 p.m. to order. All city council meetings are held in accordance with COVID-19 state guidelines. And councilors, this evening I would just like to remind you that with these new partitions, it's hard for me to, I see just glare, so if you really want to get my attention, just wave, so it's not personal, there's a different glare, so thank you. Hello everybody, we have a number of guests this evening with us. Before we start our meeting, I would just like to wish the New England Patriots good luck as they are sharing the airwaves with us tonight, so good luck to the New England Patriots. Madam Clerk, number 1.
Ordered. Appropriation of $75,000 from Department of Public Health's Bureau of Substance Addiction Services, Substance Abuse and Mental Health Services, SAMSHA, Massachusetts Opioid Abuse Prevention Collaborative, MOAPC, to Mayor's Office, Massachusetts Opioid Abuse Preventative Collaborative, MOAPC Fund. Invited Honorable Mayor Robert Sullivan, Troy Clarkson, Chief Financial Officer, Corin Cappiello, Director of Social Services.
Good evening, Madam Chairman.
I don't think it's on. I don't think the
Oh, not on? Down the bottom?
No, your microphone's not working?
None of them. I couldn't hear it.
The speakers aren't on, I don't.
Hang on one second, we have BCA right behind you. You're
Speakers
fine?
aren't on.
Okay.
I'm switched on.
Sorry, Mayor, but your microphone is working, I think.
Yes.
Yep.
I'm going to go.
We can
Just
continue.
can't hear in here, that's all.
Okay. You can't hear the mayor?
Well, the speakers aren't on, that's what I was saying.
Hello?
There you go.
Yep.
Yeah, it's working.
Thank you, Councilor Rodriguez.
Madam Chairman, members of the committee, good evening. Thank you for having me here tonight. These two agenda items, number 1 and number 2, I know we're on number 1. Corin Cappiello is here from my office relative to substance abuse and opiate abuse. As you know, Corin has worked under Mayor Belzotti, Mayor Carpenter, Mayor Rodriguez, and myself, so she is here to answer any questions.
Thank you, Mayor.
Thank you.
Any question, Councilor Cardoso? Good evening, Corin.
Good evening.
Good evening, Corin.
Hi, how are you?
Hi. Can you tell me why the purchase of service, the program budget sheet is empty? There's nothing on the budget sheet, no breakdown. It's just a total amount?
Oh,
Just curious.
yeah, probably because I get it into you immediately when I get it, but I can explain can I explain both of them at the same
Yes, of
time?
course.
Sure.
Okay. So both of these grants were slated to end in June because of COVID. We've had both of these for many years. Because of COVID, the state extended these both through this June. A new RFP just came out. So both of these grants are just kind of closeout grants. Both of these grants, we subcontract with High Point, who manages the Mayor's Opiate Overdose Prevention Coalition and the Collaborative. So 97% of the budget goes to High Point, 3% goes to pay a fiscal manager.
Out of both of these?
Yes, out of both of those. So whatever, sorry, I'm not good at math, whatever, so 72 something goes to High Point, and then the remainder goes to a fiscal manager to help with all the invoices and everything.
So most of these are just services provided at High Point?
No, so it's not services provided at High Point. It's not for treatment. It's for work done in Brockton and the mentoring communities. So it's work in the schools. It's trainings that we do. It's sticker shock campaigns. It's not for treatment. It's just that High Point's Prevention Collaborative manages the funding for our coalition.
And do you know, do they collaborate with any grassroots organizations?
Yeah, I mean, we collaborate with everybody.
So a lot of this funding, when you write for these grants, and I'm going to say this each time, and it's
Sure.
not personal, it's just
Sure.
something that's near and dear to me as someone
Sure.
that has an organization that focuses on mental health
Sure.
and violence prevention. There's a lot of grassroots organizations that have zero funding in the city that's doing a lot of great work. And so when we write for these grants, we should keep in mind that there should be a collaborative effort with these grassroots organizations that are doing really good work in the city. And, you know, we gather this data and we get this funding based on the demographics and the issues, the health disparities, all of the violence, all of that exists in the city. But oftentimes, we're not collaborating with the people that are doing the work. So I just want to put that out there. I will mention that each time.
Yep.
I don't know
I
if
just
you...
want to explain
yeah.
one thing.
Go ahead.
Anybody is welcome to come to our coalition meetings and be a part, but the state is very specific on what you have to do and how you spend this money. So this money really isn't to give to different agencies.
Right.
This money really is for capacity building, and, you know, working on specific things. A lot of it is for staffing, so that these goals and objectives can be met. So I understand your concern, and I get that, and, you know, it would be great to maybe look for other funding sources for that, but this funding, I really don't see how, because I'm hearing your concern and I get it, I'm not sure how this funding can work to actually give money to those grassroots organizations.
Well, it doesn't necessarily have to be to give money, but
Yep.
just to collaborate with them as folks that are doing this work in the
We'd
city.
love to have any of those people come to the
Right.
meetings and be more involved, absolutely.
Right, and then I can certainly call you to talk about some of these programs and outcomes, but this isn't for me, it's for the general public.
Yep.
They need to know that if you're writing for grants based on their issues that they're suffering, that there's some positive outcomes. So, and I know that you know all about outcomes and reporting outcomes, so that's something that I think in the future, Troy and I have talked about this a lot, being more transparent with these grants. I know that there's no match,
Yep.
and so folks just typically okay them, but they are written based on the information that you gather around health disparities and other issues in the city.
Sure.
So I appreciate that.
Yep,
Thank you.
understandable. We can talk about how we can maybe do a presentation or something.
Yes,
Yeah,
that would be
absolutely.
great.
Sure.
Thank you very much. Lauren.
Absolutely.
Okay.
All set, Counselor?
Yes, thank
Any
you.
other counselors have any questions?
Motion to recommend favorably.
Second.
Motion's been made and properly seconded to recommend favorably back to the full city council. All those in favor? All those opposed? The motion carries favorably back to the full city council. Madam Clerk, number 2.
Ordered, appropriation of $75,000 from Department of Public Health's Bureau of Substance Addiction Services, Substance Abuse and Mental Health Services, SAM-SHA, to Mayor's Office, Substance Abuse and Mental Health Services, SAM-HSA Fund. Invited, Honorable Mayor Robert Sullivan, Troy Clarkson, Chief Financial Officer, Corin Capiello, Director of Social Services.
Any questions on this one?
Motion for favor recommendation.
Second.
A motion's, did you have a question, Counselor? No?
On the motion.
Motion's been made and properly seconded. All those in favor? All those opposed? The motion carries favorably back to the full city council. Thank you, Ms. Capiello.
Thank you, councilors.
Madam Clerk, number 3.
Ordered, appropriation of $50,000 from Executive Office of Health and Human Services, Department of Mental Health, fiscal year 2021, Massachusetts Jail Diversion Program Grant, to Police Department, fiscal year 2021, Massachusetts Jail Diversion Program Grant Fund. Invited, Honorable Mayor Robert Sullivan, Troy Clarkson, Chief Financial Officer, Emmanuel Gomes, Chief of Police.
Good evening, Madam Chairman, members of the committee. I know Chief Gomes is here. He'll answer any questions. This is the jail diversion program that we do on a yearly basis here in the city of Brockton, and CFO can answer any financial questions as well.
Thank you, Mayor. Any questions, councilors?
I have one.
Counselor Cardoso.
The chief. Good evening, Chief.
Good evening.
So this grant makes reference to some trainings. Can you explain a little bit about the trainings that are involved?
Well, there's a variety of trainings that go on, especially for officers involved in this. As far as the jail diversion program.
Right.
A lot of that is for in-house training and how to deal with some of these issues.
And then it referenced social workers to help police out.
Yes.
Are we doing anything to increase the amount of social services that the police have access to help in some of these trauma?
I don't know, Counselor, if there is an increase, but there is, part of our diversion program is that licensed counselors go out into the field with police officers, and we're dealing with a variety of people with different types of issues, anything from drug abuse to homelessness, whatever we find we're dealing with under these circumstances, and try to find ulterior responses that may not be police-related, and we try to at least facilitate that, whether it's housing or whether it's treatment. We try and go out and do all that. That's all part of the diversion program.
Do you think we need more social service support for police? I mean, we can always use more. Do you think we should be writing for more funding to help support the police with more social services, more social workers that are trauma-informed and able to respond with you?
I would never say no to any help along those lines, especially in what we're trying to do with more on the line of homeless people, and obviously the substance abuse. Any help we could get. We do actively, as you know, we seek out any and all grants that are out there. We try not to miss any, and any that we can expand on. And I'd gladly have a conversation with you about expanding on that.
Very good.
I would say yes to all of that, absolutely.
Okay, very good. Thank you.
Counselor Rodriguez.
Thank you, Madam Chair. Chief, how are you?
Good evening.
My question is basically, how does the funding that we receive compare to similar-sized communities? I mean, we know, we know that, I mean, it's no major secret that we are one of the more violent communities in Massachusetts. Are we getting one of the most fundings as some of the other communities are?
Well, that's a good question, Counselor. It's hard to monitor that because, as you can understand, grants are largely based on how actively you pursue and how proactive you are on it. So there might be communities same size as us who might not be as proactive. We have a full-time staff member that just does grants, and we have a support staff that goes with that. And I can assure you that if there's a grant out there, we're applying for it. We're not, what I'm trying to say, Council, is if we don't apply for it, I know exactly what the city is going to get. So we apply for everything that is out there, and we have some that are pending as we speak this week. But I can assure you, Council, if there's a grant out there, Brockton's putting its best foot forward and applying for it, and with all the support data in a professional manner. And you've seen that the grants have definitely climbed, as you say, the numbers. So I couldn't tell you about other communities. It comes down to how proactive you are.
Yeah, because one of the reasons why I'm bringing this up is that and I've shared this with the community and the folks that are in this room. I mean, you look at some of these prevention grants that come down from the state level. Sometimes communities like Newton, are getting a lot more funding than the city of Brockton, where our needs here probably quadruple that of Newton. So the reason why I'm saying that is that I keep saying this is the fact that I don't think we're doing a very good job in terms of lobbying the state or the providers of these grants to make sure that they, I know often there's a fear of basically being too out in the open and scaring the daylights out of people who might want to look into coming into our community, but we're also not doing a very good service by not sharing with those grant founders with the necessities that the city has. And I think it's important for us to go out and basically try to knock on every single door. And I know you do that through your office now, but I mean, as far as not just to sit here and get a grant, but to get significant grants that we can actually put into the use, especially when it comes to prevention stuff in this community, because we've proven that time and time again that you guys do a great job in the police department in terms of dealing with crime once it happens. But some of us are more interested in preventing crime from happening. So we need to put funding into the prevention piece a lot more in some instances than combating crime, because the more we prevent, the less that you have to combat.
Well, point well taken, Councilor, but I will tell you, we've really stepped up on proactively going after everything that's out there, and at least applying for it. A lot of the grants, Brockton can show the data to substantiate the application. So we're actively on that with federal and state grants.
Well, because again, as my last point is that if we're the fourth largest school system in Massachusetts, I know that the tendency is to quote numbers from the census where I think we're 7th in Massachusetts. But if we have the fourth largest school system, I think we should quote those numbers instead of quoting census numbers, because these are children that are actually going to school, so that actually we're counting heads of kids going into school. Sometimes that serves as a bigger number out there for us to benefit us, because it's not fair that Brockton gets less funding in some instances for prevention than the city like Newton does.
I don't know exactly how some of these grants are given out. Sometimes, Counselor, I too scratch my head how they hand it out, and I'm sure different communities apply for it in different ways. I can only tell you, we do the best we can for the city and put our best foot forward.
No, I'm not saying that you don't. I'm just saying that the way the grants are dished out from where they are dished out, sometimes a community like this one here that could actually benefit a great deal from those funds aren't getting those funds. That's why I'm saying that.
Correct.
And whatever lobbying that we need to do on our part as well, too, we should all get together and do that with letters of support from the council, from everybody else, so that we, our grants can look a lot stronger than they have been in the past. Thank you, Chief. Thank you, Madam Chair.
Thank you, councilors. Any other questions?
Motion to recommend favorably.
Second.
A motion's been made and properly seconded. All those in favor? All those opposed? The motion carries favorably back to the full city council. Madam Clerk, number 4.
Ordered, transfer of $2,069,670.20 from Planning Department 40Q for $38,224.08. Planning Department Consultants for $2,677.50. Planning Department Other Services for $59,000. Police Department Vehicles for $145,584. Police Department Equipment for $32,500. Police Department Capital Projects for $450,000. Animal Control Other Services for $14,764.36. DPW Water Consultants for $114,473.49. DPW Water Street Repairs for $441,846. DPW EPA DEP Mandate Safe Water for $158,476.73. DPW Sewer Capital Projects for $159,472. DPW Highway Paving for $299,075.63. DPW Highway Capital Projects for $153,576.41 to Capital Fund for $2,069,670.20. Invited Honorable Mayor Robert Sullivan, Troy Clarkson, Chief Financial Officer, Emmanuel Gomes, Chief of Police, Lawrence Rowley, Commissioner of DPW, Robert May, Director of Planning and Economic Development, Tom DeCellis, Director of Animal Control.
Thank you. Councilors, before we begin, I just want to let you know that Mr. May did contact me to let me know that he wouldn't be here this evening, and that Mr. Clarkson can answer any questions on his behalf. Thank you.
Good evening, Madam Chairman, members of the committee. So what's before you is a reclassification relative to capital funds so that they don't go into the free cash. Troy's been working what Councilor Cardoso just said in collaboration. He's been working with the auditor. He's been working with an outside consultant as well. I know he sent an email to the council, but he's here tonight to answer any questions relative to this matter. Thank you.
Thank you. Any questions? Councilor Cruz.
Thank you. So, Mr. Clarkson, if I understand, and I know you sent out some clarification today, if we, in our budget book in the past, we don't have a capital fund, correct?
That is correct. So in the past, the practice has been when you appropriate capital money to simply encumber it at the end of the fiscal year. So what's here represents projects, purchase of vehicles, paving.
And it would always be under the department in the past.
Well, all of this money has already been appropriated by you. In the past, you wouldn't see it after it's been appropriated,
Right.
and it sort of lingers as encumbered funds.
Correct.
In the future, when you appropriate it, we'll suggest that you appropriate it as a capital item into a capital fund. So this is really a cleanup effort that's taking a practice that's been used in the past and modernizing it. So a more appropriate place for these types of funds is a capital fund. So we're not spending any additional money. We're really just adjusting where the money's held because technically, as the mayor stated, these funds, as of the closeout of the previous fiscal year, should be swept to free cash. But really, the departments that are listed need those funds for the ongoing capital projects that they're associated with. So we're just asking you.
So my question is, for instance, you know, DPW water street repairs, 441,846. We approved that when we approved the budget this past June.
Correct.
Under that department as a capital expense.
Right,
Now, we're putting it into the capital fund.
right.
Can the mayor now spend that for something else, or is that still?
Absolutely not, no.
So it doesn't change the appropriation and what we approved it for. It goes into this capital fund, but it's still exactly as we appropriated it, as we voted on it.
That is 100% correct. In fact, each of these appropriations within the capital fund will have their own code that will identify each of these appropriations. So it's really just an accounting tool. Technically, when you appropriate funds at the end of the fiscal year, unless they're encumbered for a specific purpose,
They have
for
a bill, they
specific
have,
invoice,
you've already done the work,
right.
you've contracted.
Otherwise, they should go to free cash. And so this is really cleaning up and making, and improved the process to make sure
But it
that
doesn't change our approval.
it does not.
Even though the only reason I'm concerned, I see capital fund and nothing underneath that. So I just want to make sure that, and this, as Mayor Sullivan used to say, it's not about the current mayor, it's about any mayor. As we do this way, you're not changing the will of the council. The money can only be used for animal control, other contractual services, 14,000 and some change. That's still the only place that money can be used.
You have my full assurance in the light of day that this in no way usurps the legislative authority of the council. All of these appropriations will be preserved specifically as they were intended by the council. It's simply making, it's holding the
Keeping it
funds
from the
correct way.
DOR saying it has to go to free cash at the end of the year.
Correct.
Thank you. Thank you, Madam Chair.
Counselor Farwell.
Okay, I thought I understood this, Mr. Claxon, but I think I've missed a step here. Are these funds coming from the FY20 budget that were not expended or encumbered, and therefore, if we did not do this, they would revert to free cash? We're not talking about FY 2021 amounts, correct?
That is correct. In some cases, the money has been held from previous fiscal years, which is why the alarm bells kind of went off when I saw this. And so you really shouldn't hold money for multiple fiscal years unless it's segregated as capital funds. And so you are correct. None of these funds are from the current fiscal year. These are monies that you appropriated in 20 or perhaps in 19.
Right.
That now we're putting in a capital fund for the specific purpose you intended it to be.
So it would be fair and accurate to say these are FY 2020 amounts, not FY 2021 amounts.
FY 2020 or earlier, but certainly not FY 21. That is correct.
Well, yeah, but if they were earlier, they would have reverted to free cash, and then the state would certify our free cash amount. The only, and I don't object to doing this, colleagues, but this will reduce our free cash certification by the state by $2,069,670, correct?
Not necessarily, because these funds have been encumbered. So the money has already been set aside for the purposes stated in this other spreadsheet. For instance, the $145,584 in the police was for purchase of a vehicle. So the monies have been encumbered. What we're really doing is cleaning up. You made a good point a minute ago, Counselor, that it shouldn't be from previous fiscal years, right? It should only be from fiscal year 20. But what we've discovered is, in some cases, money has been encumbered and has lasted multiple years and has not been swept to free cash. So what we're trying to do moving forward is to make sure that the funds are handled in a way that's consistent with generally accepted accounting procedures and the guidelines from the Department of Revenue.
Okay, so, and again, I have no objection to doing this, but you usually have approximately 60 to maybe 90 days after the end of a fiscal year to close out the books and to figure out, okay, I haven't spent the money yet, but I've got a contract to do something, for example, DPW water consultants. We may have a contract that we have to pay somebody out of that amount. We still, strike that. This 114,000, just focusing on DPW water consultants, all of the FY 2020 bills are paid. Everything that should be encumbered has been encumbered. This is a true and accurate picture of everything that's remaining after we have closed out the FY 2020 books.
Well, the FY '20 books are in the process of being closed, but what we have done, my department and auditing have worked very closely together to make the exact determination that you just mentioned. So, and we, at the end of the fiscal year, conducted an analysis of how much was left that would go to free cash. And these amounts are still required for the projects that are ongoing. For instance, this 450,000 in capital, right? You've appropriated some of that money a couple of times because particularly the 150, that's for the police department roof. And if you remember last year, that was not asked to be encumbered and it went to free cash and you had to reappropriate it this year. So this $450,000 has been set aside, and it really should be set aside in a capital fund and not simply encumbered, because that's not the best way to handle those funds.
Okay, and I'm sure it's legal, but just for the record, we are okay transferring funds from the FY '20 budget at this stage here in October?
Oh, yes. Well, free cash hasn't been certified yet, and the books haven't been closed. And I should tell you that this process, because it's been painstaking, this is the result of dozens of hours of work by both the auditing department and my department, in consultation with our consultant, Mark Abrams, who is one of the foremost experts on municipal finance in the Commonwealth. So it's really been a collaborative effort over several months to get us to this point.
Okay. All right, thank you, Madam Chair.
All set, Counselor Rodriguez.
Thank you, Madam Chair. Mr. Clarkson, how are you, sir?
I'm well, thank you.
Shut this thing off. My question is on the, with the police department and the $145,000 purchase of cars, vehicles. Do you know, or does the chief know exactly what you're going to be using those funds for? To purchase what kind of cars?
Well, I will defer to the chief, but this is another good example. So this money was appropriated by this body to purchase vehicles. One of the challenges right now with police vehicles is the lead time is very significant between the time you order them and the time you receive them. And so I know that the chief has a standing order out for several cruisers that have not yet been delivered. So this money is for vehicles that have already been ordered. Is that correct, Chief?
Counselor, just to echo some of the statements that were made, this is for uniform marked routine patrol cars that are assigned to the patrol division. We're trying to update our fleet, getting older and they're getting out of warranty. It's an issue for us repair-wise. That being said, the turnaround time to get cruisers prior to COVID was already 23 weeks waiting time. So it's going to happen on a routine basis where we may order a car during one fiscal year and then take delivery of it, and payments not due till, there's going to be a lot of crossover payment during the fiscal years from one to another because of the time lapse that it takes us to actually put a car in a commission.
Because the reason why I'm bringing that up is because when I was downstairs in the mayor's office, you notice I didn't say mayor, I was just downstairs in the mayor's office. One of the issues that we had were with some police cars. For instance, the two weights and measures SUVs that we have are either 13 or 14 years old, because I remember when I was in the Harrington administration, that's when they first came in.
Yes.
And I just have noticed that they're still on the road. I mean, I don't know exactly how they're still operating, to be honest with you, because aside, one of those, I think I saw it the other day, it's all rusted out. It's basically an embarrassment, to be honest with you, for a city of this size and magnitude to have that kind of look out there. Because I used to, I remember every time we had a parade, anytime we did something in the city that required or we wanted police cars, I was always calling the chief and saying, can I get the black SUVs? Can I get the black SUVs? But right now, they're actually kind of an embarrassment, to be honest with you. And that's the reason why I'm asking, because I remember when I was downstairs, we put in some funding to purchase some cars.
Well, yes, and we've also been able to get vehicles through other ways too. Sometimes when we have 2 or 3 that have been in accidents or have been totaled, we compile the insurance money and take the money from 2 and buy 1, so that's rotating. Those vehicles have been upgraded, by the way. They've been on the ground less than a week. So understand, Counselor, that because it takes so long to get cars, we have to basically get the order in the pipeline. Like I said, even prior to COVID, it was 23-week wait. And then we went through the greater part of COVID. They're open now. But Ford factory wasn't even producing any vehicles. So it's going to be even longer. What I'm trying to tell you is that if I order cars today, I definitely will not see them till spring.
Okay, what about the traffic division? Because I remember, again, going back and having a conversation with some of the guys, this is prior to your arrival, with some guys in that division. They were borrowing cars from each other. They would borrow it from the detectives and borrowing it from the gang unit and vice versa, in the sense, so that they can go out and do their job in traffic enforcement in the city. So are they in line to get some newer cars so that they can actually go out and do their jobs as well?
Council, the 2 traffic cars arrived here, I believe it was last Thursday or last Friday, for the traffic enforcement specifically. 2 of them are targeted for that, and they will be replacing the old ones that you were mentioning, which are to the point, because they were not frontline cars, they were still responding to things, and they were literally too expensive to maintain, and they were unsafe. That's why we cycled the cars, but those cars are actually been in operation this week.
So they're actually on the road now doing
They're
their-
actually on the road.
doing their thing?
We have ownership of them.
Okay.
They're actually here.
Okay, all right. Well, thank you.
Thank
Thank you, madam.
All set, Counselor Thompson.
Good evening, Mr. Clarkson. I appreciate your, the email that we received earlier today. It did provide some clarification. But I just had a couple questions. So we're not establishing a capital fund here. This is an existing fund. Is that correct?
Yes.
Okay. And just talk about the future. You're saying that with this vote, that there would be no requirement for future votes for this process. Can you discuss, so how is this going to move forward now with the designation of these funds moving into the capital fund?
You will still vote the capital purchases, but at the time that you approve them, the monies will be designated to the capital fund, right? So this is modernizing and improving a process that in the past was less tight than it is now. And so what we're asking you to do now is to take money that, but for us discussing it, would have been encumbered and just sort of hung out in the ether until the money was spent. Not a best practice. So what we're trying to do is tighten the process up and accounting for capital funds where they should properly be, and that is in a capital fund. But to repeat what I said to Councilor Cruz, however, the monies are segregated within the fund specifically related to the appropriations that you make.
So looking from where these funds are coming from, say the planning department or the consultants. So obviously that's not a capital fund account. So at some point there was a decision to use monies in that account for a capital need. And we vote on transferring those funds to be allocated for a capital need. Is that correct, or?
You vote money in the budget, and within that, some of those items, let's use the cruisers for an example, because that's, I think, something we can wrap our heads around. You vote the money, and that portion of it is just voted as part of the general fund. In the past, if those cars hadn't arrived by the time the books were closed out, the money would be encumbered. And it could just sort of stay out there. What we're trying to do is designate these funds properly as capital funds so that we don't have money that's just lingering out there for undetermined amounts of time. This, by the way, coincides with a memo that the auditing department and my department issued jointly today after a significant amount of work that's trying to educate the departments on an improved way to do things and telling them. So in the future, for instance, at the end of this fiscal year, if departments intend to encumber funds, it has to be consistent with DOR guidance in the Commonwealth law for a specific purpose, for a specific invoice. So if Chief Gomes orders a car and he's got an invoice for $28,000, that $28,000 can be encumbered. But if he had a budget amount for $150 to buy 5 cars and doesn't have an invoice, then that money really shouldn't be encumbered because that's not the nature of an encumbrance.
So once a amount becomes encumbered, it would then move into this capital fund account?
No, when it's appropriated, it would be appropriated into a capital fund. So you know that we also have an ordinance here in the city that requires me to submit a capital plan. What we hope to do, and what we're in the process of doing, as we've discussed, is in the future, capital requests, capital purchases will be submitted to you via a capital plan. I think it's 2-298 is the ordinance, rather than asking you to expend operating funds for capital purposes. So it's part of really a global effort to streamline the way we ask you to appropriate funds and the way we account for them.
So there would be, instead of, your initial request would be for a capital request, instead of switching the monies around for the capital appropriation, you're now going to start asking for specific capital funds per department, and those monies would then go into this capital fund.
Yeah, essentially. Okay. I mean, the appropriation process will be the same. Any purchase for any capital purchase will come before you, will be vetted through you. You'll have the option to approve it or not. What'll happen next is really a function of accounting, but it won't change in any way the process that you go through to approve the funds.
Okay. Thank you, Mr. Clarkson.
All set, Counselor Cardoso.
Good evening, Troy. So my issue, and I'm just going to read this, in the future, capital funds will be appropriately identified during the original appropriation, so this vote will not be necessary moving forward. Has this been the practice in the past? What brought us here? We all know I didn't vote for the budget, and this is one of the reasons why, because I needed to do my research to kind of look into these things. But I feel like this is something that should have happened during, when you voted for the budget. So now you're saying in the future, we will avoid this particular vote right here. But I'm thinking, what brought us here? Why are we here? Why are we doing this? That's the bigger question to me. Sure. Because we're trying to avoid something, it makes it seem like we did something wrong.
Well, let me answer your second question first. To be clear, when I say the vote won't be required, that means taking money that's been previously encumbered and transferring it into a capital fund won't be required. However, let me be crystal clear. This is in no way taking away the ability of the council to approve capital funds. What related to the conversation I just had
right.
with Councilor Thompson, at the time you approve these capital purchases, from an accounting perspective, they will at that time be classified as capital funds, so you won't have to then later transfer the money. So
why haven't we done that?
Well,
in the past.
So I'm here now, and one of the things I was charged to do was to look globally at the practices and work with our team to improve on them. And so what I've done is work very closely with our auditing department, with my team, with our outside consultant, and look at everything we do and say, how can we improve and do a better job? And so that's what I've been charged to do. And so I'm before you to try to improve and, as I said, modernize some of the practices that have been conducted. You know, things change over the years, laws change, regulations change, and I can tell you, having worked in several municipalities, that once a process is in place, it's sometimes almost an immovable object, right? And so there are some processes here in Brockton and in Tewksbury and in Rowe that have been done the same way for a long time. And so what we're trying to do is to take a fresh set of eyes. That's why we brought Mark Abrams in. He teaches classes throughout the Commonwealth on how to do things properly, and said, let's work together and figure out how we can improve how we do business. So that's what we're trying to do.
Okay, thank you.
All set, Counselor Ianieri.
Thank you, Madam Chairman. Good evening, Mr. Clarkson. How are you?
I'm well, thank you.
That's good. And I do want to take time to commend you, your people, your staff, and the auditor's office for taking a look at this type of, I guess, new way of, budgeting through the fact that we would be able to do and continue to do some things with some capital projects that are needed within the city of Brockton. And when I say that, I mean the entire city of Brockton. That even accounts for what needs to be done even with our school buildings and school department. For all the years I've served in both areas, there was always a page, used to be line item or two, but it begun to be a big page of capital improvement projects and what they were going to cost, and nothing ever got done. It was just something you just talked about every year, and you never found a way to work around it. I think what you're trying to do here only shows that we're trying to do something in the best interest of the city in itself and for the taxpayer as well. So I do commend you on that, and I look forward to what you can do to continue to improve this, because I think it's something that drastically needs to be done. I just want to leave just one thing that I've always, excuse me, been a little bit of a stickler with, and I was with Mr. Condon, is the police department and its vehicles, because that department needs vehicles all the time, constantly all the time. I've always spoken that for the 17 years that I've been here as a counselor. And as everybody does know, some do know, but I worked in the automobile business and happened to also see these police vehicles when they were under repair. When the company I worked for at that point had the contract to work on the vehicles, and it was ever so amazing of the condition that these vehicles were in. And to know the run miles, so a lot of people don't know, they don't realize the run miles are on these vehicles, and all of a sudden realize what the run miles were, and you see these cars just go flying by you, at 100 miles an hour because they have to, and you begin to wonder, how strong is this vehicle? And it brings me to the issue I used to have with Mr. Condon, and I think I mentioned to you a couple of times, and I love to see us get into a way that we could start to lease vehicles. I think leasing would be somewhat I think a little bit more of a greater impact to what the department would have for needs of equipment, and that's the number one piece of equipment they need. Not so much having the telephone or having navigation in the vehicle, but you need the vehicle in itself. Could you give that some thought? I hope as we move forward, even into the next budget, because I think it's something we should be looking at. You may disagree with me, but I know you've been involved in municipalities over the years, so and there's a lot of them that do that now, because you're always constantly going to have new vehicles, and I think that's what's very important. So if you could take a look at that over the next few years, I'd appreciate that. Thank you.
Certainly, Councilor. And leased vehicles is a common occurrence in municipalities. In fact, the vehicles that we just purchased, the electric vehicles that ran out to the end of their lease and that we purchased, were leased for some time. I would suggest to you that emergency response vehicles, police cruisers, not fire engines, obviously, although you can lease those, are not best suited for lease because of the heavy use, and they're subject to accidents and things like that. However, regulatory agencies that respond, building department, planning, those sorts of vehicles that are not frontline first responders, I think are more conducive perhaps to a lease than others. But it's something that the city has done in the past, and certainly something to consider in the future.
Yeah, no, great. Oh, I appreciate that. Okay, thank you. Thank you, Madam Chairman.
Thank you, Counselor. Mayor?
Madam Chairman, I just wanted to follow up on what Councilor Ianieri was saying. When Mayor Carpenter was mayor, he did lease motorcycles for Brockton Police. And when I became mayor, the leases were up. So we did acquire 3. We purchased 3 of those. The other ones were given back for the condition. So definitely not opposed to leasing. We'll just do a hard analysis financially, Councilor.
Yeah, I think it only makes sense, and it's in the best interest of that department as well, too. Yeah, thank you.
Thank you, Councilor.
Thank you, Mayor.
Thank you, Counselor. Any councilors that haven't asked any questions on this item? None? Counselor Fowler?
Mr. Claxon, I'm sorry, I thought of 2 more questions. So for FY 2022, we will have a capital fund appropriation, and we'll get a list of things that we want to fund for FY 2022, and it'll be enumerated like this, and then the council will have a chance to see exactly where the funds would be expended from that fund for those specific purposes, correct?
That is correct.
All right, and the second one is, so this, and not to throw around these half-baked terms they use at the state level, but this becomes a retained revenue account. Anything you don't expend because we're going to have this fund would remain. So at the end of the fiscal year, if you had an extra $150,000 in the capital fund that you did not spend, that would stay there, and then the mayor, whomever he or she might be, could say, well, this money is left over, we want to buy 3 more police cruisers. Have I got that right?
The first half, yes. The second half, no, because the money will be in this fund only for its intended purpose that you have voted. So, yes, the reason why we're doing this is so this money survives fiscal years and the projects can come to fruition. But if, let's say, you appropriated $65,000 for a police cruiser and you only spent $60 on it, that the discretion does not exist for that money to be simply reappropriated by the executive to any other lawful purpose. Would have to come back to the council.
Yes, yeah. But the mayor
yeah.
the mayor could take what was remaining in that capital fund that was not spent and say, fortunately, we saved some money, and now I want to put it here. Will the council approve that?
Absolutely, yes. That's in most municipalities, a very common occurrence, whether it's city or a town, to then use those extra monies and through the legislative process, reappropriate them to another purpose.
All right,
yes.
thank you. Thank you, Madam Chair.
Thank you, Counselor.
Motion to recommend favorably.
Second.
A motion's been made and properly seconded. All those in favor? All those opposed? The motion carries favorably back to the full city council. Madam Clerk, number 5.
Ordered. In compliance with the provisions of the election laws, notice is hereby given that the state election will be held on Tuesday, November 3rd, 2020, in various polling places. Invited, Cynthia Scrivani, Executive Director, Elections.
Good evening, Madam Director.
Evening.
Do you
So
have-
I have a copy of, I sent everybody an email, but I did bring a hard copy of the report, the evaluation report. Does anybody want a copy?
Yes, if you don't mind, if you can have them passed out to us, Erin will pass them out for us. Thank you. Any questions? Counselor Thompson?
Good evening, Cynthia.
Good evening.
I had a couple questions regarding mail-in ballots, if at all possible. So regarding mail-in ballots, where are they stored once you receive one?
The ballots
Yes.
are stored in the safe in my office.
Okay. Are there any additional security precautions regarding the storage of the ballots, or they're just in a safe in your office?
They get delivered to us, we process them through VRIS, and then they get put in my safe. And I am the only one with the key to my office.
So you're the only one who has access to that safe? Okay. Are they opened prior to Election Day?
No, they are not. They come in A brown envelope comes inside the white envelope. We open the white envelope, we timestamp the brown envelope. We make sure that it's signed because it has to be signed. Then we close it back up, put into VRIS that we have received it, attach the application to it, and put it in the safe.
So the
And then
brown,
it gets opened on election day at the polling location.
so that's when the brown envelope is opened, which has the ballot in it. So,
Exactly.
okay. And then regarding, so where does the ballot go on Election Day? Does it stay at you and counted in your office, or does it go to the polling place, or on Election Day, what happens to that ballot?
On election day, when the police officer comes in the morning, we put all the ballots that we have, the absentee or early voted ballots that we have received from now until then, into a bag, and the police officer transports it with the unvoted ballots to the polling location. And then it's treated like you're there. The warden will open it up, they read the name off, and then they feed it right through the machine.
Okay, so they're divided up and each go to its own polling place in which the voter resides?
Yeah, exactly, yes.
When the ballots are counted, are there independent observers that watch the counting of the ballots? Or can you talk about that process?
Okay,
Who's
so-
there when a ballot's
So
opened or
at the end
counted?
of the night, of course, you have the poll workers, you have, it's open to the public, so anybody can watch. If a candidate has a checker, they can stay there. You have canvassers come in, so that they can actually, if there's hand counts, they can actually make record of the hand counts and stuff, but it is all open to the public.
Okay. Well, I appreciate that. Thank you.
Certainly.
No further questions.
Thank you, Counselor. Counselor Rodriguez.
Good evening, how are you?
Good, thank you.
I just have a quick question for you. Are you all set with poll workers?
So we did have something on the website, so I have received a lot of applications from that. I think we are all set. I'm still accepting applications, and we are mailing out letters. They went out in today's mail to do a training session coming up next week. We're actually going to do a mock election.
Are you prioritizing maybe multilingual individuals to help out?
I'm always, always, always asking for multilingual.
Because this continues to be a problem, especially in the center core of the city where the population is a little more diversified. We have had quite a bit, not just in these past elections, but in previous elections, where people come to the polls, they don't speak much English to try to figure out exactly how that system works. They have had a real tough time conversing, and there's been some instances where people have been denied the opportunity to vote because they can't do it themselves, and they somehow, it depends, I guess, on whoever's in charge of the polls to let somebody else come in with them and help them out. So if we could just, perhaps, and one of the things that I wanted to talk to you about, and I think I was going to call your office and have this discussion with you, and possibly, I remember back in the days when Farwell was the mayor here in the city, we had a problem with the police department not having a lot of bilingual, multilingual individuals, and we created this interpreter pool with Pedro Bosch when he was still around to be able to go into the police department and provide language services to the community. I think this is something else that we might be able to do in terms of training individuals in the community who are able to go into the polls and just provide that language services to help those individuals who can't vote, who cannot understand the language fluently and actually able to vote for themselves. So if we could, perhaps work on something like that, it might be able to take care of some of the problems that we're having at these polls.
Yes, I agree. I'm always reaching out for multilinguals. Anytime anybody applies, we put everybody on the list. Everybody gets a letter. And then from there, I would pull the multilinguals first. But it's very hard to get poll workers, multilingual or not, to
Well,
come
you have
and say-
quite a few of them, but what I'm saying is that I wonder if you are putting them in places that they can provide better service. Because if I'm multilingual and you put me in an area that actually is very affluent, I might not be able to help you as well as I would in the middle of the city. So perhaps kind of balance it out in the sense where we all know where a lot of the seniors and individuals that might have a language problem might be able to actually reside. So perhaps in those poll locations to have those individuals there who are able to help those individuals out might be a better way to do it.
I'll certainly work on that.
Thank you. Thank you much. Thank you, Madam
Thank you,
Chair.
Counselor. Counselor Fowler?
Just to be sure, following up on my colleague, anyone can bring an interpreter with them, correct?
Absolutely, they
And
can
a-
bring
and a
anybody they want
handicap-
with
Oh,
them.
I'm sorry, I didn't mean to interrupt you, so, they can,
Yes,
and anyone who's disabled a handicapped person can bring someone to assist them, correct?
correct. They
Okay.
can bring their whole family.
All right. By the way, when someone registers to vote, do they have to read anything and acknowledge it or sign it, or, I wonder how they get back, how do we get them through that initial, perhaps, language barrier?
When they register to vote?
Someone walks into your office and says, I want to register to vote, but perhaps they have have limited English-speaking ability. How do we get them over that threshold to read what they're signing and acknowledge that they're a voter?
So we
and
do
where they
have
live?
applications in 4 or 5 different languages, but if they can't understand me and I can't understand them, I always go over to the mayor's office because they have multilingual people over there, or over to the clerk's office also because they have some multilingual, so that they know what they're doing in the
So-
process.
And just, again, following up on Councilor Rodriguez, if someone comes to a polling place and there really is a language barrier, do we have the ability to call another polling place and have someone either respond or?
Well, I ask that they do call me, and then yes, we could maybe put someone on the phone that speaks their language, or, and I try to tell the poll workers all the time, you just have patience and try to work with them. But if you can't understand them, then call a different poll worker over, maybe they could understand them, or call me, because maybe I could get an interpreter on the phone with them, or, maybe I could pull someone from a different polling location and bring them over there, or I'm certainly willing to do whatever it takes.
Well, thank you for your efforts and good luck in the year 2020, the way things are going, so,
Thank you.
thank you.
Thank you, Counselor. Counselor Cardoso?
Cynthia, hi.
Hello.
I have a question, just when you mentioned patience just now. How extensive is the training for poll workers? Are we evaluating that level of patience? Because there is complaints about being mistreated, poll workers not treating people properly at the poll places and not having that level of patience. So that's one question. The other one is, we don't pay them enough. What is it, $150 for 8 hours?
But it's from 6 a.m. until 9, 10,
Right.
11 o'clock
So it's a
at night.
long day for $150.
Very long day.
So typically, you're not going to get young folks to commit to that. So you get a lot of older folks maybe that just want something to do and they don't really care about the money. And oftentimes, and I love, that's what I do, I'm a geriatric nurse, I love the elderly, but oftentimes they don't have that level of understanding or patience with people coming into the poll. So is there anything we can do first? What is the training like? Is it just, hey, you're hired, or are we doing anything?
No, so I do have usually hold training sessions once for every election cycle. I have now just started stressing the last couple of trainings, the importance of patience and the importance of we're very diverse, so you have to have patience, and the importance of being nice, and even to the poll workers themselves. I've heard some stories where the wardens are being mean to the poll workers, and in my opinion, that is unacceptable. It's unacceptable for a voter to be treated with anything but respect, and it's unacceptable for poll workers to be treated with anything but respect. And I stress this, and I say that I'm sorry that I even have to stress this, because it should not even have to be said. But that's some of the things that I have stressed in the election. And with the elderly, you're right, it's like old home week. They get together twice a year with this group of people, and it's tough to get them
Right.
sometimes to listen. They've been doing it for years. I can't tell them what to do. They know their job better than I do. Even though I stress the importance of certain things that they're supposed to do. That's why this year for this election here, because it's gonna be crazy, I have decided to hold a mock election with wardens, clerks, and inspectors all in the same room, so everybody knows what everybody's job is. We go through the process A to Z, and hopefully with, what problems I think may arise, and hopefully they'll be better able to handle it on election day.
And where do we get the
But-
funds to pay the poll workers? Where does that come out of it? And are we able to pay more so that we can get younger folks or bilingual folks to commit to it?
Well, I really don't know the answer to
Last year,
that
I
question.
got 4 of my friends to do it, and I had to beg.
Yes.
And so, because they, $150 to spend all day there,
With an hour for lunch and an hour.
with an
to
hour,
dinner,
yeah, it's
right.
just a lot to
It's-
ask.
Especially where minimum wage is $12.75 now, so I don't even think they get into a minimum wage, so.
Right.
It is tough. I am getting it looks like some young people now because they're not in school. And I reach out to the high schools too. I've been reaching out to them. They've been great sending kids for election days when school is not open. And the kids really work out well because they're bilingual,
Right.
they're young.
Okay, all right, thank you and good luck.
Thank you.
Yeah.
All set, Counselor Nacastro.
Thank you. Good evening.
Good evening.
Thank you for being here. So my first question is about signage, because you and I have talked about putting around signs, Election Day is coming, November 3rd, and all that, in various locations in the city and also on the electronic billboards. Will that happen this year?
We do have some signage. I know I just did buy some more signage.
Great.
For,
Great, good.
probably not enough, but yes, we will have more signage.
And we also have to talk about the venue locations for 2 of the precincts.
That's right. 2 of the precincts have called and asked because they have high-risk patients, they have elderly in their housing, they have asked us to not hold the elections. One of the places, the Douglas House, has said that once all this is over, they would be more than happy to host the elections again at their polling location, but for right now, they think it's safer for their residents if they do not.
And that's Ward
2A,
2A.
which is the Emmanuel House, and, the Douglas House.
2A.
2A,
and
the Douglas House, and
right.
4A, the Connemara Senior Living, which used
That's
to be
right.
the Emmanuel
And
House.
that's 4A, that's right.
That's 4A.
So where are you going to have them instead?
So the Emmanuel House, so the Connemara Senior Living, which is Ward 4, Precinct A, we're going to put them over at the Gilmore School with Ward 4, Precinct B, because they have a big gym, so that we can put both of them in there. And for the 2A, the Douglas House, where we want to move it over to the Barrett Russell School, which is on Oakdale, which is still in 2A.
And of course, since those 2 changes, one is in Ward 2 and one is in Ward 4, that's why Councilor Monahan and I are co-sponsoring this order. Now, because we're making these changes, we have to comply with state law and make certain findings, right? That's why you did a report for us?
That's right.
Okay.
Yes.
And do you want to summarize your report?
So it's submitting that the public health and public convenience would be better served during the ongoing COVID-19 pandemic by relocating the 2 polling locations. The city submits that changing the Ward 2 polling location or either polling locations will have no disparate adverse impact on the access to the polls on the basis of race, national origin, disability, income, or age, for several reasons. Do you want me to read the reasons?
Yes.
Okay. The Barrett Russell School is a city-owned public school building that educates students of all races and national origins, comprising our diverse city and voters in Ward 2A. No voter should feel uncomfortable or unwelcome entering and voting within the Barrett Russell School. The Barrett Russell School is accessible to voters regardless of income, disability, or age. The building is handicap accessible and provides adequate parking for voters. The building is also within a half mile from a Brockton area transit bus stop for voters in need of public transportation. The city is confident that the building is equipped to safely house necessary equipment, personnel, and space for voters. The Barrett Russell School is easy to locate within Ward 2 and is within a mile from the prior polling locations, which lessens inconvenience to voters that may need to be redirected to the new polling location on Election Day. It submits the changing of the Ward 4 polling location to the Gilmore Elementary School would also have no disparate adverse impact on access to the polls on the basis of race, national origin, disability, income, or age for the following reasons. The Gilmore Elementary School is a city-owned public school building that educates students of all races and national origins, comprising our diverse city and voters in Ward 4A. No voter should feel uncomfortable or unwelcome entering and voting within the Gilmore Elementary School. The Gilmore Elementary School is accessible to voters regardless of income, disability, or age. The building is handicap accessible and provides adequate parking for voters. The building is also within a half mile from Brockton area transit bus stop for voters in need of public transportation. The Gilmore School is easy to locate and has traditionally been used as a polling location for Ward 4B. The city is confident that the building is equipped to safely house necessary equipment, personnel, and space for voters. Although the school is located in Ward 4B, the Gilmore Elementary School is within a mile from the prior polling location, which lessens inconveniences to voters that may need to be redirected to the new polling location on Election Day. Based on the foregoing evaluation, oh, that's not for me to read.
Okay, thank you, that's very good. So this evening, you're asking us to adopt this report,
I am.
right?
Yes.
So that you will be determining, well, I'll put it in my motion, but we'll be determining that we agree with this and we adopt it as our own. And that is required by Chapter 54, Section 24 of the General Laws.
Correct.
Okay, thank you.
Thank you.
Thank you, Madam Chair.
Thank you, Counselor. Any other questions, counselors? Oh, well, Mayor, did you want to?
Chairman, I just had a couple points of information, if I could. First of all, I want to thank Councilor Cotto. It was $150 for the clerks and $200 for the warden. I mean, that was good 15 years ago. It is an ordinance. It's spelled out in the ordinances. So if any councilors want to put that forward, I'll support that, but it would have to go through the ordinance amendment process. But it's long overdue. The clerk shared with me that it used to be $75, so, I mean, who's going to do that for a whole day? In terms of the process that Councilor Castro just talked about, it was already ratified by the school committee, which I chair, because they ultimately had to give approval if we could use the school, B.B. Russell, Barrett Russell, and also the Gilmore. And the last thing is the in-person early voting at the Westgate Mall. In September, it was just 1 week at the old Payless inside the mall, next to where Dunkin' Donuts used to be in the interior. If you have kids, it's where Santa Claus sits at Christmas time. But this will be for 2 weeks in November. We've made a commitment to do it for 2 weeks. And I just want to make sure that we all get that information out, because that's going to be helpful. Thank you.
Thank you, Mayor. So I can't not comment on this, as I worked the elections for over 20 years, and it was not for the money. And I think when I first started, it was $75 a day, but there's something about being part of the process that's really, you know, it's fun, and so I miss it. And I want to recognize Cindy, who actually worked on getting a lot of the polling places new boots, which made a huge difference, because the other boots were run down, old, and fabric. So these are not only new, but they're also very sanitary and very COVID-friendly. So I know they looked beautiful when I went into my polling place to vote. As far as you know, councils can work on getting, increasing the amount that is paid, because that does come from the budget. I know Councilor Cardoso asked you, it comes from your budget that they're paid. And I think we would get some, you know, young people maybe take a day off from work to be able to come in and be part of the process. Cindy, I just have a quick question for you, which is, with these polling changes, and I know that the Gilmore School used to be years ago a polling place. How are you notifying these residents?
So we are going to send out a letter once this goes through the council and it gets approved. I will have letters all ready to be mailed out for every registered voter in Ward 4A and in Ward 2A. We will also put it on our website and on all social media.
Perfect. Thank you.
You're welcome.
Any other, all set? Do you have a
And,
motion,
just one
Counselor?
thing on the early
motion.
voting. It is open 2 weeks, the 17th to the 30th, 2 Saturdays, 2 Sundays.
Perfect.
Okay, I'll make a motion. Thank you. So I'm going to make a motion that we recommend finding that, or we recommend favorably that the change in the polling locations as described this evening will better serve public health and public convenience and will have no disparate adverse impact on access to the polls on the basis of race, national origin, disability, income, or age. How's that? Can we do that?
Second.
Okay.
Motion's been made and properly seconded. All those in favor? All those opposed? The motion carries favorably back to the full city council. Thank you.
Thank you, councilors.
Madam Clerk, number 6.
Resolved as follows, that the City of Brockton should consider amending the current curfew and allow Brockton's restaurants to operate later daily, or in the alternative, to operate later Thursdays, Fridays, and Saturdays. Invited Honorable Mayor Robert Sullivan, Dr. Herman, City's medical consultant, Chris Cooney, President of Metro South Chamber of Commerce, Hamilton Rodriguez, restaurant business owner.
Councilors, Chris Cooney did contact me, and unfortunately, he wasn't feeling well. Had some sort of a cold, so he felt that it was best that he did not come here this evening. So I just wanted to let you know. Councilor Mendez.
Thank you, Madam President. I'd like to give some additional context regarding this resolve that is before here tonight. Councilor Cardozo made a statement regarding this issue last Monday, and I'd like to elaborate a bit further. On Friday, September 25th, we were invited to attend a meeting held by local business owners regarding the city curfew. The business owners had a petition asking the mayor to lift the 11 p.m. curfew due to the fact that restaurants are greatly affected by the city curfew. The business owners wanted to hand-deliver the petition directly to the mayor to ensure that it had been properly received. Councilor Cardozo and myself accompanied them to City Hall. It was communicated to us that the mayor was busy and he did not have time for the business owners. Yet, the business owners wanted to wait for the mayor. After about 20 minutes, we asked the mayor's staff to stamp the petition as a confirmation that it had been received, and we left City Hall shortly thereafter. Later that day, we attended the council at large meeting at the high school, where the mayor was one of the invited guests. I approached the mayor to speak to him about the event that had occurred earlier that day. What happened next were actions and words by the Mayor Sullivan that were demeaning to not only Councilor Cardozo and myself as a woman, but to all women. With a raised voice and body movements, it was clear that the mayor had lost control and was very angry. The situation reflects some sad parts of our society, that some men think they can talk down to a woman just because they are a woman. I am confident that Councilor Cardozo and myself, if we were men, Mayor Sullivan would never have talked to us that way. The mayor would not allow me to speak. Before I could even finish my first sentence, the mayor began to loudly yell at me in a confrontational manner in public for doing my job as a city councilor by being a voice to these business owners. Mr. Mayor, I tried to speak to you in private. Since you didn't allow me, I must do it now in public. Councilor Cardozo heard and saw the actions and yelling by the mayor towards me, and approached to ask what was going on. At that moment, the mayor directed his insults at Councilor Cardozo with the same yelling and disrespectful tone of voice. The mayor was out of control. The mayor only stopped his disrespect directed towards us when another councilor interceded to start the meeting. I was shocked of how two councilwomen duly elected by the city of Brockton were treated by our mayor. What is really sad and upsetting is to know that this type of behavior against women is not new. What we had to deal with, every woman in this country has had to deal with in some form, in some shape, in some point in their lives, by men who attack women in this manner. What happened Friday night, September 25th, is not about one isolated incident. It's about the mayor feeling comfortable enough to mistreat two councilwomen in public in front of city leaders. You, mayor, disrespected women in public. You, mayor, yelled and reprimanded us for doing our job as city councilor. You, mayor, lacked respect towards women. By doing that, you gave permission to other men to mistreat women in our community. And I'm here to stand up and to say that that is not acceptable. The city of Brockton will not tolerate this type of behavior. Thank you.
Madam President, I would like to respond because this is not germane to resolve, but I'm happy to discuss it. I served 14 years up here, and quite honestly, to hear that is not the full story. Councilor Castro was there, Councilor Fowler was there. That is not what happened. But at the end of the day, I made it clear why I couldn't meet with these fine people. I was in the process of doing a Zoom interview with a gentleman from St. Louis, Missouri, about the parking authority. And I had indicated to Councilor Cardoza I wouldn't be able to. I had on that schedule, I didn't disrespect these people, I'd be happy to, but I was in the middle of doing something, Councilor. And at the end of the day, listen, I'm a dad, I'm a husband, I'm a son. I've hired more women in my office than anybody else. I'm flabbergasted by what you said, Councilor, but you can have your own opinion, I can have my own opinion. But as I said to Councilor the next day, I went up to Councilor Cardoza the next day at Dunkin' Donuts, and I said, Councilor, we both love Brockton, we both have passion, but we have to work together. I said that, and I mean that. And I want to talk tonight about what the resolve is. And Councilor, with all due respect, you have your own opinion. I strongly disagree with anything you said. Many of these people served with me for many, many years up here. They know who I am. I'm not anything what you just represented. But with that being said, I want to talk about the resolve, and these people are owed a responsibility from me as the mayor and you as councilors to talk about the resolve. You filed the resolve late, and that's fine. I filed many late resolves. But what is happening right now and how you just opened it is unacceptable. It's truly shocking, to be honest with you, Councilor. You said you tried to reach out to me. I don't know when that was. But we're here tonight to talk about what these business people are going through. I did a Zoom with Mr. Rodriguez the other day. I did a Zoom with Mr. Angelo 2 weeks ago. At the end of the day, and I said this to Council with all due respect, she's a registered nurse. My job right now hasn't happened in 100 years of pandemic. We're trying to save lives. As of right now, 290 people are dead from the city of Brockton, men and women, young and old, gay and straight, white and black. That's a fact. So for you to open up like that, Councilor, I was duly elected like you, and I respect you as an elected official. I strongly, strongly disagree. It was also witnessed by the police chief. Let me see who else was there. The Board of Health would have been there. Superintendent Thomas was there. So let's get the facts out. But these people want to know when the curfew is going to be lifted so that they can get more business. And that's why the resolve was filed, Council President.
Oh,
Thank you,
Madam Chair, point of order.
Councilor
No.
Cardoso has a question.
No, Council Fowler has it. He said point of order.
Okay, go ahead,
All
Councilor.
right, my point of order is that we should concentrate on the resolve that is here tonight. But because we have just heard information, and because there were many witnesses there, including me, I would respectfully request that you, Madam Chair, work with the mayor and obtain some statements from the witnesses who were there, Superintendent Thomas and the police chief and the others, because I think it's important not only to the mayor, but to this body to understand what went on. We've now put this in the public record, so now let's do the right thing and let's hear from the independent, objective witnesses who aren't members of this body, who don't work at City Hall, and perhaps at some point the mayor can expound upon the fact that there was no appointment made to see you that day. So, thank you.
Thank you, Counselor. Counselor Cardoso.
So I was there, Mr. Mayor, and I commend my sister Rita Menz. You did a great job, better than me last week, because I had a statement last week. It was disrespectful, and I agree with her that if we were men, you wouldn't have treated us that way. And my second point is, these people came into a city hall that belongs to them. City Hall belongs to them, doesn't belong to you, nor me, nor no one in this body. And just to go back on our former mayor, Mayor Carpenter, even Mayor Rodriguez, they could have been sitting in that office with the President of the United States. They would have said, "Excuse me, Mr. President, let me go outside because there's some folks out there." They would have walked out there and said, "Hey guys, calm down. You know, I'll get to you in a little bit. I'm in my office with someone." We actually witnessed a person walk outside of your office and leave your office, and you still didn't come out. So just, you know, to Councilor Farrow, I was there. So you want to talk about witnesses? We were in front of the mayor when this happened. You were sitting far from the mayor, and you most likely didn't witness what he said to us or hear what he said to us. So just to let you know, Rita, Counselor, I respect you. You did a great job. Kudos to you, and I hope the mayor apologizes to us for the way he disrespected us, because all we were doing was representing the people. Now we can move forward with the
Public Counsel, I would like to say this. If anybody felt disrespected, I apologize. But I also know that I had told you that I was doing interviews, that they had a meeting. I'm happy to meet with anybody. I'm happy to meet with anybody at any time. That's why we serve the public. That's why we run for office. I'm happy to do that. But I also know that there's a process in place, and there are people in the office. It doesn't matter if it's Moses or Bill or Linda. In terms of scheduling, I'm happy to do that. I really am. But I'll tell you right now, the main focus right now is, and you're going to hear from Dr. Herman, who's here tonight, there's a massive spike happening in Brockton right now. So before the curfew, we were red classification. I put a curfew in place. Didn't want to do it. I'm not trying to hurt people. I'm trying to save lives. I'm trying to minimize the spread of a virus that's killing people in Brockton. So once the curfew in place, the original curfew, as you recall, in March, was 9 p.m. I went to Attorney Bridges, who's now the solicitor. She wasn't the solicitor at the time, and also Attorney Bartlett, and I said, is there any way we can bump it up even higher? Because really the catalyst for the spread, and you're going to hear from Dr. Herman, was we believe a lot of parties, a lot of shenanigans happening late night. So they said, well, what do you think? Is there any way we can adopt it a little bit later? 11 p.m. was what was decided. 11 p.m. is what happened. 11 p.m. I stand by because those parties have minimized. We were on a call today. Chief Gomes has said, yes, the parties have minimized. Have they been obsolete? No, but they've been minimized. Now, at the end of the day, do I want businesses to flourish? Absolutely. We want what's good for them is good for everybody in the city of Brockton. But right now, my job as mayor is to make sure we have a healthy, safe community for all. Healthy, safe community for all. So if you look at the top 10 municipalities in the Commonwealth of Massachusetts with the highest number, Brockton is in that top 10. Brockton is the only municipality with a curfew. Brockton is the only one that's yellow. Everyone else but Randolph is red, high red. So, has the curfew worked? It has. But to the credit of Mr. Rodriguez and to Mr. Angelo, when I did Zooms with both of them to talk about it, Hamilton asked me point blank, do you have statistics or metrics that can show that? We don't, but we also know that if we look at other municipalities, the Chelseas, the Lynn's, the Lawrence, that are similar in scope to Brockton in terms of our demographic makeup and size, and they're high red and we're yellow, something's working right. The parties have minimized. Now, with that being said, what you're going to see today is in the last 4 or 5 days, numbers are going up. The state does metrics for 14 days. 13th to the 26th was the last one. This Wednesday, we're going to get another 2 weeks. And what you're going to see is there is a high probability that we're going back up into red. So today we had 10 positive cases. We've had 12 the last couple of days. We had 11 a couple of days ago. We had 11 the other day as well. So those metrics themselves are showing that numbers are going up. My question to Mr. Rodriguez the other day was, And I wasn't trying to disrespect anybody. My question was, how many people are coming into George's Cafe to have dinner at 10 o'clock or 11 o'clock at night? That's a legitimate question. I want to know. And Mr. Rodriguez, to his credit, said, well, he makes a lot of money during that time frame. As soon as we have a safe community, my number one thing is to see the spread decrease, see the body count that I get every day decrease, make sure kids get back in the classroom, especially our kids that are special education that need that. We're not there right now. We're not there right now. But I'm going to publicly say right now, Council, I'm happy to meet with you to talk. Council, I'm happy to meet with you to talk. Because at the end of the day, we're on this together. When I stood up there, what did I say? This is about collaboration. Previous mayors did not collaborate with the city council. Previous mayors did not collaborate with the school committee. That's a fact. So my role is to do that. Did any of us think that we were going to have a pandemic come to Brockton and hurt our businesses and kill our people? No, we didn't. So if there's passion here, compromise and collaboration, let's do it. Let's do it. And I'm happy to do that. But I honestly am going to say to you, Councilor Mendez, I do never disrespect women. I don't. So I would love to talk to you further about that. But I would like he spent hours prepping.
We can have Dr. Herman present the PowerPoint presentation, and then we can take questions from, to the business representatives. Good evening, Dr. Herman.
Evening. Thank you very much. Okay. Well, thank you for inviting me. The mission in coming today is going to be to try and explain where we have been with COVID in the city of Brockton, where we are right now, and maybe even predicting where we're going to be in the near future. And I apologize because I got you on both sides of me, but I can only look at one screen at once and point this thing at one screen. So I apologize if I'm going to have my back to somebody. So first thing I want to say is that COVID has had an effect on my profession as a healthcare provider, and just want to point that out, that in the city of Brockton you have people working hard at Good Samaritan Medical Center, at Brockton Hospital, at Neighborhood Health Center, and that the numbers that are put out today by the CDC really only represent a tip of the iceberg of who may have been affected, only because they only account for about 25% who answered the question or got the demographic information on whether there were healthcare providers or not. And so just to be aware of that fact. Not moving. Okay. So I'll start at the top and kind of work my way down. This is what COVID looks like in the United States of America right now. You've all seen the numbers, and the red line is the average 7-day trend. We're hovering at about 40,000 cases a day. We thought it was going to be coming down last month, but has come right back up again and has really plateaued at about 40,000 cases a day. This is what Massachusetts looks like according to the CDC. So this is today's numbers, with day 212 being yesterday. And what this is I'm trying to show you the graph the way Massachusetts likes to look at the numbers between 4 and 8 cases a day. What this is a daily cases a day per 100,000 population. And the two lines, the two parallel lines at the bottom are between 4 and 8 cases a day. And you can see that over the last week or so, that number has gone from about 4 cases up to just a little over 8 cases. Now, the CDC measures a 7-day rolling average. The Department of Public Health uses a 14-day rolling average. So that big number that you see every week in terms of red, yellow, or green really is measuring a 14-day average. They publish it every Wednesday at 6 p.m., and that number that they publish is a 14-day average, not leading up to that Wednesday, mind you, leading up to the Saturday before that. So the number that comes out on this Wednesday, October 7th, will be ancient history. It will really be talking about what happened 2.5 weeks ago, leading up to last Saturday, October 3rd. And you can see on the right-hand side, that's a list of what the numbers would be 2 weeks ago was kind of in the high 4s, and today it's up to 8.3, according to the CDC. This is another metric I look at. I know you can't see it, but it's basically the R value, the rate of transmission. The arrow's pointing to Massachusetts, which is ranked number 5 or 6 in terms of the worst transmission. So anything in the red means COVID is spreading. Anything in the green means COVID is under control. Most of the states, COVID is spreading. Massachusetts is one of them. In fact, it's one of the worst. And I'll kind of give you this is just looking at it in a little different format over time. We were really bad at the beginning of that graph, which we were in the red zone in March, and then over time, we kind of dropped down as various actions were taken at the state level, and now we're slightly in the red area. Not the same red area that we're talking red, yellow, and green, but a red area meaning cases are spreading as opposed to not spreading. So many of you have seen this map. This is a heat map of the city of Brockton, just representing where the cases are. For the most part, it's right down the central corridor of the city, except for the big red blotches on the right and on the left, which of course are the skilled nursing facilities where we had some significant outbreaks. And we can break that down even more. We've partnered with the Academic Public Health Corps, Volunteer Corps, which is a group of all the public health schools in Massachusetts whose students and faculty are volunteering to help local boards of health in terms of gathering the kind of data that the usual and customary data gathering does not get through the Department of Public Health. So, where have we been? This is, as of today, 4,868 cases in the city of Brockton, 290 deaths. Thankfully, the death rate has come down significantly, but we still do get 1 or 2 cases a week. And many of you may be familiar with this. This is the dashboard that we publish on the city website every day. This is today's dashboard. It does have a lot of information. It tells you how many new cases a day. And the new cases a day, just so you understand, that's just cases that were logged today. That doesn't mean they happened today. It means a positive test came back today. It could have been from yesterday. Could have been from a week ago, could have been reassigned from another municipality that decided, hey, this person doesn't live in Randolph, they only work in Randolph. So it's a constantly changing number, but 10 were reported today, no new deaths. Active cases, 153 active cases. A week ago, there were fewer than 100. So the numbers have really been going up. There's 10 in the hospital, although on our hospital call today, my guess is that it's probably a little bit higher than that. That's the number that's reported to the Department of Public Health, but the hospitals are a little bit concerned that they are seeing some increase in cases recently and have sent communication to their staff to that effect today, just to be extra vigilant about PPE and hand hygiene, distancing, et cetera. The graph in the middle, I change that every day just to kind of change it up a little bit, but this one that is here on Monday is just the number of cases per day. And again, I put in the 4 and the 8 because the Department of Education is looking at those numbers. Anything above 8, they're recommending remote education. Anything below 4, in-person education. And between 4 and 8, recommending that a hybrid model be considered. And the big number on the right in the yellow box is 6.0. So as I said, that 6.0 is ancient history. It's a number that the Department of Public Health publishes every Wednesday at 6 p.m. It could be calculated every day, and in fact, I'm hoping to get access to a new data set in the near future within the next week or two so that I can actually do my own calculations and figure out where we are on a daily basis. But if you want to cheat and know where we are today, all you got to do is look under the word Brockton in the bottom right-hand corner in the blue box, and I'll tell you the number that I think we are at today. Okay, so this is a number where I think we're going to be at today, as opposed to what the big yellow box is. So based on where we are over the past 14 days, our number should be about 8.9. So this is how it's calculated. This Wednesday, October 7th, somebody's going to push a button at the Department of Public Health and figure out how many cases were there in the 14-day period between September 20th and October 3rd. And by my calculation, that number will be 8.2. I don't know if that's accurate or not. I've been kind of fairly accurate, but anything can change between now and Wednesday. Cases come and go. It's not just a fixed number. You might think it's going to be a fixed number, but tomorrow a case could come in that was tested last Friday. There are duplicate cases that fall off the roster. There are cases that get reassigned to different jurisdictions. But my best guess right now, if I had to make a guess, would be that it'll be 8.2. Okay. So what this is just a history of each Wednesday going back in time of where we've been. So I'm predicting that on the 7th it'll be 8.2, maybe not, we'll see. But over the last 4 or 5 weeks, it's kind of been in a yellow zone there. We were up in a red zone for a few weeks. And before that, the state was not doing these calculations, but this is just based on the numbers that exist and what we would have been had they been publishing these numbers. So we were down in the yellow zone in the middle of July at that point. And I'm going to have a hard time with this. But what we've done is, right now, the mission is to try and figure out where cases are coming from so that we can take actions and address those rather than just have a broad brush approach to COVID-19. We'd like to know where the cases are coming from. And right now, just based on kind of the conversations that are going on, people are a little bit nervous. So the people who are following the statistics. Today I got an email from Sue Joss at Neighborhood Health Center showing me her cases. Her testing from 2 weeks ago was kind of in the 3% range. Last week it had nearly tripled up into the 10-point-something% range, and she sent me one word, which was yikes. Now, yikes is not necessarily an approach to how to deal with COVID, but it definitely is alarming that the testing at Neighborhood Health Center has tripled in the last week. What we've done in the last several weeks is got help from the CTC. So the CTC is the Community Tracing Collaborative. They are the arm of Partners in Health, which the state has enlisted to help do all of the contact tracing. And for my money, that's where the answers are on how to control the spread of the virus. Because in the history of man versus pandemic, pandemic always wins. And so the best we can do is just try and control things as best we can until treatment comes out, which will happen in a few weeks or a few months. Testing comes out that'll let you kind of do your home testing, brush your teeth, do a COVID test, take a shower, go to work or not, depending on the test. And then, of course, the vaccine, which is over a much longer period of time. But now we have weekly calls with the epidemiologic investigation unit, the CTC. So this is kind of like CSI Brockton, but for epidemiologists. And they've agreed to work with Brockton and be on a call with us every week and handle the contact tracing, because it's not quite as simple as just calling someone up and doing the contact tracing. You might have a case from another jurisdiction that we don't know anything about. So like, for example, this was a case of a house of worship in Brockton that had 60 attendees at a religious service, followed by a dinner. As we all know, 25 is the max, but they had 60. 4 people ended up being positive. Okay, they weren't in that town. Relatives in another town, morphed into another town, morphed into another town. 20 or 25 people ended up being affected from an event that happened in the city of Brockton. We knew nothing about it. Why did we know anything about it? Because no one in that cluster was a resident of the city of Brockton. So Town A had some, Town B had some, Town C had some, and the CTC investigators were able to correlate it and put it all together. Now, in this particular case, it sort of petered out. The clergy person involved refused to cooperate with the Board of Health. The organizer of the event refused to give the CTC the guest list, and so we were really unable to delve any further into those 20 or 25 people. Another one, this was a different kind of event, and I haven't broken it down by time, but another cluster in the city of Brockton happened at the United States Post Office. So somebody went to work sick, went to work every day sick for a week, and ended up spreading the virus. Problem there, Post Office said, we don't really deal with the local Board of Health. We have our own federal tracing program, so we don't want to talk to you. So we've run into some barriers with terms of people cooperating with us. They also, when the CTC calls us, they also kind of break it down as to how many cases come from private residences and household contacts, work contacts, healthcare providers, that kind of thing. So we're starting to get a much better idea in the city of where we can target our efforts. So this is data from UMass, from the Donahue Institute, and it kind of shows the number of COVID cases in the state. The big dark blue cities, there's 6 of them, are the 6 that have more than 350 cases per 10,000, more 3,500 per 100,000, meaning more than 3.5% of their residents have gotten COVID. In Brockton, we're kind of hovering right at about 5%, so 4.9-something% of all of our residents in the city of Brockton have gotten COVID. So if we look at Brockton, 493 cases, which is when this was published, probably about a week or 2 ago, and our number was 6.0. If we look at the top 10, this is the top 10 cities in Brockton, in Massachusetts, ranked by percentage of COVID cases per 100,000. And you can see what their numbers were posted last week. When ours was 6.0, others were higher, except for Randolph. We have to call Randolph and find out what they're doing. But all the other cities were higher. Now, what does Brockton have in common with these other towns? Well, just about everything. So we have high, and these are ranked also by Donahue Institute in terms of people of color we know are disproportionately affected by COVID-19. Frontline workers, of what Brockton is ranked the #1 city in the 301 towns in Massachusetts in terms of frontline workers at risk for getting COVID-19, and so on and so forth, with virtually every socioeconomic aspect of care. So that if we look at these top 6 cities, the top 6 that are in that dark purple, you can see that it's a challenge. No matter what we do, it is going to be a challenge. Curfew, no curfew, it's going to be a challenge. But I do think that the curfew did help in terms of bringing our number down compared to others. Now, I don't know how long we can maintain that or what the future is going to hold, but I do think it was effective. So,
Dr. Herman, I don't mean to interrupt you, but if you can just speak into the mic so they can hear.
It won't reach.
Oh, okay.
Okay, so once again, let's go back and see our weekly numbers and where we've been each week. I'll come back.
Thank you.
So what this is the same thing as the previous graph of the weekly numbers, but it's just looking at it daily. So if instead of publishing this Wednesday afternoon number and picking a number, if every day we published that number and looked at it from the beginning of September, that's where we'd been, somewhere hovering between 4 and 8. And just now, I think, or I'm predicting, at least based on the math, just sort of now, just hovering above 8. But there's another perspective we can take a look at. So rather than just looking at from the beginning of September, let's look at it from the middle of May, which is when I came on as a consultant for the city, and kind of our numbers were in the stratosphere, so it's just unmeasurable, really. And we came down, and really for the past many months, from a pandemic point of view, we've kind of been in the same place. We've sort of been in that 4 to 8 range, hovering in there for whatever measures that were put into effect, been able to control it, and unlike the United States of America that went back up again, we've kind of been able to have a handle on it and stay in that range. But as you can see, over the last several days, things are getting a little bit out of hand, and really, my prediction is that they're hovering to the high 7s and low 8s. But there's another perspective. And this is just showing that when the curfew did get put into effect, the numbers did seem to come down in the period following that. Whether it was a cause and effect, I don't know, but the other 10 towns or 6 cities that had high numbers that didn't have curfews remained in a red zone. And this is the other perspective. So this is the perspective, and maybe not as pessimistic as this is looking, into not this flu season, but after the next flu season. We are in this for a long time, and everybody has got coronaphobia or corona fatigue, or we are all just sick of it, and there are no winners. It's just a lose-lose situation, so it's constantly deciding what can we do to keep the numbers down, because at the end of the day, right now, in my opinion, one of the major goals is get the kids back to school. And the only way you get the kids back to school is by getting the number down, because if you send the kids back to school when the number's high, it's just going to spread virus around your city. So I think one of the changes that we have to make is just in terms of the mindset of realizing that in the first few months, maybe there'll be a treatment, kind of like a monoclonal antibody treatment, so that if somebody gets sick, they'll at least know they're not going to die because you have a monoclonal antibody that's going to bring your virus level down by 99% over a 7-day period. Then there'll be some rapid testing so that everybody will have access to a bucket test at your home, spit in a cup, run an antigen test, and at least be able to know whether you should go to work or not. And then there'll be a vaccine that may or may not be accepted, but certainly is going to be extended over months and months and months, maybe even a year or two. Which brings me to today. So today was the start of Phase 3, Step 2, when the governor has said we can relax things in the restaurants and have parties of 10 in a restaurant and increase the number of diners that we can have in a restaurant, at least in areas where COVID was low. Now, Brockton, at the time, right now, still officially is 6.0, and so fits into this category of low transmission, or at least not high transmission, and so that's the change that went into effect today. And I think that's a serious concern. So what I recommend to the mayor, just in my role as a consultant, is because I see the numbers going up at the hospitals, at the neighborhood health center, in the city, and that these numbers are, I don't want to say skyrocketing, but certainly trending upwards towards the 8 people per day per 100,000. I would say that we should maintain the curfew until we see some kind of downward trend in the numbers. That I do not think that Phase 3 and Step 2 should have been implemented for our city, and so I would like to see that rolled back, and I would like to continue working with the epidemiologists so that we can get a better idea of where the cases are that are occurring and have a sort of a little bit more surgical attack to being able to come up with measures to address those concerns. That's what I got.
Thank you, Dr. Herman. I know that Counselor Thompson has a question, but this was, I know Counselor Cardoso had her hand up earlier.
Thank you, Dr. Herman, for all of that information. So as you know, I'm a registered nurse, not specialized in infectious disease, but I want you to clarify something for the public. So we can wrap our heads around a shutdown, right? You shut it down, people stay home, they don't go out. We help slow the spread of the virus, right? Help folks at home understand how a curfew, that 11 o'clock curfew, especially for restaurants, let's think about restaurants. You leave to go to a restaurant, you sit there for 2 hours. So if you've had COVID, you've already exposed other people. If you don't have COVID, you've been exposed. So now you leave there at 11 and you go home. How can you justify, or how can you make that, how can you help folks understand the rationale behind that? The other thing is these parties that we were having over the summer, like you said, a lot of the folks that attended the parties weren't from Brockton. So that's number one reason why you couldn't contact trace a lot of that spread, those clusters from those parties, right? The other issue you have to understand in this community, there's a lot of stigma around COVID-19. So the fact that you have these numbers is not taken into consideration that people are not testing and they're continuing to stay home using home remedies and not telling people that they have the illness because of the stigma around it. There's huge stigma around it. So people don't want to be, Cape Verdeans especially, Haitian community, they don't want to be to blame to pass an illness to anyone. So I want you to keep that in mind when you look at these numbers, because to me they're not representative of what's really going on in this city from someone who lives here and, and I know the community well. So those are a couple things to consider when you're looking at businesses that are suffering. You have to be able to explain your rationale. The other, culturally, to the mayor's point, Cape Verdeans don't go out to eat till 9 o'clock, 10 o'clock at night. That's what we do. We don't eat at 5 and go home at 8. That's not what we do. We come from an island. We're on island time all the time. And when I go back home, we don't go party until 1, 2 in the morning. So culturally, it's embedded in us. We eat late. We socialize late. So you have to keep that in mind. So these business owners are suffering because their people they're not going to go out at 10 and then go home at 11 o'clock. So I want you to be able to explain the rationale, for this curfew at 11. To me, I can understand, and a lot of people can understand shutting down like we did when COVID first hit. But to allow people to leave their homes and to conjugate and then go home at 11, to me, I can't wrap my head around that. So would you please speak to that?
So would your preference be that we just shut it down again?
I'm not saying that's my preference. I'm saying to help people understand why the 11 o'clock curfew, specific to restaurants.
Well, the curfew seemed to work. So whether I can prove that or not, the statistics are the statistics. I think what you're telling me is that because there is a stigma in a certain segment of the population who may not want to fess up that they're sick or go get tested, only means to me that there's even more COVID out there than we're measuring. Mm-hmm. So my response to you would be, why would you want to pursue an activity that's going to spread the virus? So why would you want to bring someone indoors in a closed environment without a mask, maybe poor ventilation, for a long period of time? So all the things that spread virus, indoors, no mask, close contact, long time, and let's do that even more hours. Why would you want to do that when we have an alternative to not do that, that seemed to work?
So you mentioned 2 clusters. One was at a post office and one was at a church. So
the CDC specifically, when they posted the website and then brought it back down again, as they have done, mentioned 3 areas that were particularly high risk: churches, restaurants, and health clubs. Okay, then they took those down, but those seem to be kind of hotspots for, high likelihood of spread of disease. So no one is specifically closing down restaurants at 11. They're closing down everything at 11. And it seemed to be that it was really initially in response to social gathering, people getting together. This is what happens. It's very easy to understand. Any time that you got people close, no masks, long time, but we all have total control over it, okay? We have near total control over it. So my response would be, why roll back some kind of situation where you're going to increase the spread? If the goal is bring down the numbers, send kids to school, that's the goal. Now, I don't want to say listen, you can either open your restaurants or you send kids to school, take a pick, which do you want? Now, I'm not being quite that dramatic about it, but in a sense, it's always a choice between bad and badder. And there are no good solutions. Somebody is going to suffer no matter what decision gets made. But for me, right now, at least my sense was in going to the school committee and being on the calls with the mayor every day and the hospitals and nursing homes and everyone else that I'm talking, my sense is that there's a priority in this city to open up the schools. And that to open up the schools, you got to bring the number down. To bring the number down, you have to do something. Because if you do nothing, then you're just Everett and Chelsea and Revere and everybody else with 17.6 cases per 100,000 patients. So that would be my, my
And I appreciate that, and that's why we have you to consult and advise us. But I would also remind you that folks aren't going home. So when they leave the restaurant, they go into each other's homes, they go into their basements, they go into their backyards, they're still conjugating. How we stop the spread is education. And I've said this since the beginning. We were very late in disseminating information in different languages in this community and doing the outreach that we needed to do. So that's how we stop the spread. We continue to educate, not by having these these restaurant owners pay the price for people who are being irresponsible. They're doing the best they can when folks are inside there. I visited these restaurants, okay? And you go in there and they're doing the best they can to follow the guidelines. Once people leave there, they can't control what happens when people leave there. So people conjugate in homes, and the police have done a fine job over the summer breaking up some of those big parties, and that was great, and some of the folks conjugating in the parks. Those are all important steps to trying to, stop the spread of this virus. But education is key, understanding this community is key, chipping away at the stigma, holding workplaces accountable. What are we doing as far as enforcing those guidelines that Massachusetts has put in place for these businesses? A lot of our workers continue to go to work sick, and the employers are allowing that. So those, to me, are the bigger pictures. Not shutting down a restaurant at 11 o'clock. The kitchen has to close at 10, right? If they're going to close at 11 o'clock. So then, essentially, you're closing them at 10 o'clock when the patrons just got there at 9. So that's why I asked for, Mayor, for you all to entertain this resolve to allow the businesses, even if it's 1 or 2 days, to stay open a little later. And I thank you for your expertise in this matter. Thank you.
All set, Councilor Cardoso?
Yes, thank you,
Before
Madam.
we move on with questions, I would just like to recognize that we do have members from the business community here with us, as well as a representative, which is Mr. Hamilton Rodriguez, that's here as well, if anybody has any questions for him. Councilor Thompson.
Thank you, Madam President. Thank you, Dr. Herman. We appreciate your work for the city. It's you're doing a great job, and again, this presentation was very informative. So the resolve is regarding, I think the idea of the curfew, I think that's a proper one. I think by looking at how Brockton stands out from some of these other towns in which we're similarly situated, that we had a lower outbreak over a period of time. I think we can, with no other evidence, suggest that the curfew had some effect on keeping our numbers down. And I don't think there's a overall some sort of opposition to a curfew in general. But I think we have, you said, why do something that may lead to some future increase? looking at the numbers you just stated, it looks like we're experiencing that increase now with the current curfew and other guidelines in effect. So it looks like that's happening regardless of the curfew. So, and we also have a different job. You're a doctor, epidemiologist, or no?
Emergency physician.
Okay, emergency. So, you know, you're looking at this through a specific lens, which is what we're paying you to do. I think we have other things that we're looking at. And so I think what we're trying to do is balance some of the equities here. And what we're trying to balance is we're hearing from our restaurant community, and we're hearing that they're getting crushed. As to Councilor Cardoso's proposition that we have a large Cape Verdean community. That community has a different nighttime entertainment process than some of our other communities. So, what we're trying to do is balance the equity, see if we can find some way forward which protects our citizenry and also allows our restaurants to not flourish, because in this situation nobody's flourishing, but to provide them some relief from the conditions that they're now under. Now, I understand, and I believe the mayor, you spoke real quickly about it, and I think you did as well, Dr. Herman, that there are no statistics which we can point to that talk to the spread of COVID in a restaurant setting. Is that correct?
No, I think there were no statistics that can prove or disprove whether enacting a curfew, in fact, causes the numbers to go down, other than just the peripheral kind of circumstantial evidence that those cities that didn't do it are still in the red. That was all. Well, there's plenty of evidence about how bad restaurants are in terms of spreading COVID.
So, okay, so there are statistics showing.
Yeah, I mean, I don't have them here, but restaurants are a very high-risk area for spread, as you might imagine. I mean, it's people close together, long period of time, no mask. That's what spreads COVID. And so even with social distancing, it's still, 10 to a table now. I mean, I don't know how you can social distance 10 to a table. Theoretically, all these people should be from the same household, but it's highly unlikely that that's going to be the case.
Okay. So then what about, do you believe there's a significant increase in chance from being in a restaurant from, say, 11 p.m. to 1 a.m. than there is being in a restaurant from 8 p.m. to 11 p.m.? Like the risk is there, they're open, people are going to be there, so that risk is going to be present regardless of whether they close at 11 or 12. Would you agree with that, or?
I don't think I got the question. Well, if you said they're still going to be there, but obviously if they were closed, they wouldn't be.
No, I'm saying they're going to be there from 8 o'clock to 11 o'clock.
Right.
So they're still going to be there in the restaurant setting.
Right.
I'm saying the difference, by increasing it 1 hour longer, or 2, or whatever may be, or nothing. But let's say that 1 hour increase. Do you see a significant chance or significant increase in chances for that extra hour or 2 than what already exists in its present form?
Sure. I don't know. I don't know that much about whether it would be additional people that would be going to the restaurant or whether they'd all be cramming in a shorter period of time. I can't answer that question other than the obvious, which is if you have people doing it for a longer period of time, there's a higher risk of spread.
Right. So I just think some of the discussion should be balancing that risk, that potential for risk or whatever that risk may be, against helping our business community, not suffer as they are.
My wife is a restaurant worker, so I get it. Okay?
Oh, great.
I totally get it. But, my colleagues are medical people who have to take care of the sick people and dying people who come into them in the city of Brockton. And so, they're not sitting out in the audience right now saying, hey, wait a minute, don't open up the restaurant, don't do something that's going to bring us more patients. We've got enough as it is. And we don't have students sitting out here saying, wait a minute, don't do something that's going to make COVID go higher in the city. We want it down so we can go back to school. There's all kinds of competing elements here. I get it. There's no good decision to be made, which is why all I can do is make my recommendation based on the medicine to the mayor. And as I've said many, many times, thank goodness I don't have to make those decisions. He's the one that gets to make those decisions, or you all do, because it's going to upset somebody. It's going to have a negative impact on somebody. I get it.
Now I'm glad you brought up your recommendations, because you still have them up. So you're saying maintain curfew. Now, when you're saying overall curfew, right? Correct? When you're saying maintain curfew.
Yes.
Would you ever separate the curfew from restaurants, or? No.
I wouldn't do that, only because restaurants, churches, as I said, and health clubs sort of are the top three in terms of areas of spread. So specifically, I would not ever make that recommendation. But there might be other things, that could relax a curfew. But I just find that when you cherry pick like that, you open up a Pandora's box of someone else saying, well, how come I can't stay open that late too? Listen, I want to go to the restaurants. I want to go to the bars. I want the businesses to be open as much as anyone else. I get it. But, my role is to make the advice on what do I think that decision is going to do for COVID.
Right.
And I think it's going to make it worse.
Well,
and
that's
already really pretty bad.
Well, I mean, that's why we have you here, Doctor, and that's why I'm asking the questions, because I want to better understand the issue. So when you say until a significant downward trend, can you further elaborate? What would a significant downward trend be, in your opinion?
Yeah, so I would say, the state is using kind of 3 weeks in a row of, moving in a direction. They'll even say 3 weeks sort of staying in the yellow would be a significant downward trend, or at least significant period of time. That's what the state says, and I'll go by that, because I'm here, and I don't want to be crazy about this, but if you looked at that last graph, we're going to be in this for another year or two. And 3 weeks is sort of kind of a drop in the bucket. Wouldn't you rather see 3 months of a trend going in the right direction, like we saw March, April, May, June, and down like that? So, but 3 weeks would be at least someplace where you would have a rationale based on what the Department of Public Health is using as their metrics.
Okay. Doctor, again, I do appreciate your service to our city. I understand that we're increasing in our numbers. I look at the dashboard every day. I saw 18 just 3 days ago. That is concerning, but I'm just seeing if there is a middle ground here. We care so much about our business community, our restaurant community. They've been suffering for a long time, and if there's anything that we can do for them, whether it be a day, 2, I mean, we're not talking daily, like as it's written in the alternative, if there's 1 or 2, 3 days that, that we could increase the curfew as it pertains to restaurants, I'm sure that would be appreciated by a restaurant community. But again, thank you for your time, Doctor.
Thank you, Counselor. Before we continue with counselors, I know Mr. Hamilton Rodriguez, if you'd like to come up, you are an invited guest. If you'd like to make a few comments, and then we'll continue with the questions from the counselors.
I want to start by saying flu shots and the flu can also kill you as well. So I just want to point that out. Mr. Mayor, members of the council, appointed officials, and other public administrators, I wholeheartedly thank you all for giving me this stage tonight and to argue something that's been affecting us for a long time. We as Brockton business owners are currently handcuffed by the city with no understanding as to how your policies are going to improve COVID-19 percentages. The questions are, is there statistical or factual data that specifically shows that this 11 p.m. curfew has stopped or reduced the spread of COVID? And the Dr. Herman answered no. So with that being said, the state issued the Phase 3, Stage 2 amendment, so I think we should follow what the state's telling us to do. Our business have been suffering for quite some time, and basically, our livelihood is at stake, okay? And basically, I think there has to be middle ground here for everyone, you know? Quite frankly, we need to come to a compromise because, you know, a lot of us business owners have capital invested in the city. We're very passionate about everything that happens here. And basically, we understand that most of us are not essential business owners, and we're limited as what we can do and how we operate our businesses. However, it's not fair for essential businesses and essential employees to have the privilege to make money while others, like us, can't or make limited amount of money. Therefore, the following that I'm going to say are demands that we want as restaurant owners that we'd like to see happen immediately. Or at least compromise, meet us halfway. This 11 p.m. curfew has to be lifted. It has to be lifted. Or at least give us Thursday through Saturday leeway to operate during our regular hours. Allow us to have live music to be played at restaurants, or at least a 3-piece ensemble with including a vocalist, okay? There are other demands I want to make, but I'm not going to get into all that right now. And basically, you know, we talk about, you know, maintain a curfew until significant downward trend. What does that mean? We need to set a goal here and work towards that goal. Even if we don't make that goal, we need to set a goal and say, okay, we have a problem, what's the solution, okay? We already identified the problem, all right? Now, the solution is X, Y, and Z. We're gonna have this in the city, that in the city, and whatever, okay? And then we all work towards that goal, whether it's education, you know, awareness, bring people out, more testing, and so on and so forth, all right? And I personally think that, you know, if we do goal setting, we'll have something to reach. But right now, to say we're going to have a curfew indefinitely doesn't make any sense whatsoever. It does not make any sense. We need to set goals in life, in business, school, whatever. Goals need to be set, okay? And we work towards that goal. To say, maintain a curfew until significant downward trend. When the heck is that going to happen? Next 5 years? I don't know. It doesn't make any sense whatsoever. So if we can have a compromise here, all right, and basically say, okay, we're going to lift this curfew, you know, November 1st if X, Y, and Z happens. Now, November 1st comes around a week before. If these guidelines haven't been met, then we extend it for another month. You know, but at least it gives people expectations, okay? Expectations. That's what we need, expectations. I can't sit here in the dark, sitting here every single day wondering, when is this thing going to be over? When is this thing going to be over? This goddamn thing, excuse my language, has been going on for over 6 months. Everyone's suffering, not just me, okay? So if we can at least set a goal, a basis of what we're going to work on, educate the community, get more testing done, and get this stuff over with. Mm-hmm. And quite frankly, this stuff is getting out of hand. It's getting out of hand, and I just don't know what else to say to convince you guys. Let's do a compromise. I understand asking for 11 o'clock curfew is kind of out of reach, but give us Thursday, Friday, and Saturday to make some money here. You know, taxes have to be paid to the city. Insurance has to be paid, okay? We got creditors breathing down our throats, you know? I don't know what else to do, okay? So the doctor says, yeah, people this, people that, but I'm not gonna be the one here with the hot potato because X, Y, and Z is happening. I understand kids have to go to school and everything else, but why do I have to suffer? Why? You know? Or why does the other business owners have to suffer? Why do restaurants have to suffer if we're following the protocols that the state already issued? So I hope you guys can understand where I'm coming from with this, okay? And basically have some sympathy for us restaurant owners. We need to operate with our regular hours, and we have a $4,000 bill coming up for license renewal. We haven't made enough profit to cover this bill. Most of us haven't. Where's this money gonna come? It's gonna fall from the sky, right? It's gonna fall from the sky for us to pay these licenses and renewals. I understand the licensing commission is gonna cut it in half or whatever. That's still not enough. And a city offers us $10,000 relief. That's not even gonna cover 3 days of expenses at a restaurant. And then to apply for these $10,000 reliefs, you know, it's like pulling teeth. You know, they want this application, that application. They want this certification, that certification. It costs more money to apply for the damn relief than it is to get it. And by the time you get it, you're already 20 grand in the hole to get 10 grand. And this relief, it doesn't even put a dent into the expenses that we've incurred in the past 6 months. We're playing catch up here. And once we play catch up, once we do open, we're behind the 8 ball here, okay? We're behind the 8 ball right now. Imagine when we open, then what? We're behind on suppliers, okay? Behind on water bills, behind on electric bills, gas bills, and so on and so forth. What are we supposed to do? What are we supposed to do? I understand COVID is gonna kill us if we don't stop it, but the flu's gonna kill us too if we don't stop it. Something's gonna kill us. And if we close this down, bankruptcy is gonna kill us. So we're gonna die either way.
So, Mr. Rodriguez, that's why we're here this evening. Obviously, we're listening, the mayor's office is listening, everybody's here to try to find a solution, but as you know, we're all dealing with this. Our hearts are with everybody, and we're all affected in one way or the other, and that's why we're here this evening. So, thank you for your statement. I know Councilor Monahan had a question.
I'll ask him. I have it. Now, I know we have a unique city with a lot of different ethnic restaurants, and like Tina said, I mean, I've gone to many fundraisers for my Cape Verdean Haitian friends. I get there at 7, and I'm sitting there by myself. So I know it's like 9 o'clock, 11 o'clock. I'm like, are they ever going to get here? So the Haitian Cape Verdean restaurants, what hours are you looking at that you need to be open to make the same money as your regular, you know, whatever, like a Brax or George, whatever? What kind of hours are you looking at that you need on those weekends? Maybe even Friday and Saturday. Well, I don't know, whichever one, Thursday, Friday, something like that.
Well, first of all, we paid our licenses for 2 o'clock license, 2 o'clock time frame. That's what my license says.
Mm-hmm.
Sunday through Wednesday, 1 a.m., sorry. Thursday through Saturday, 2 a.m. So basically, I make money, the bulk of my money, honestly, nightlife, okay? 11 to 2, that's where the bulk of the revenue comes in. Okay, so what I'm asking is for a compromise. Thursday, Friday, and Saturday. Okay, we'll do the curfew 11 o'clock. But I can name you over 10 underground parties that they're selling illegal alcohol in the city and no one does nothing about it. Okay,
well, if we know about them, the police are just like that couple of parties. But if they're doing underground, there's not a hell of a lot we're able to do. If they're doing that on their own, that's the responsibility of who's doing them. So that's not the city's fault. That's these morons that are running these parties. So that's not our, it's a problem. If we find out about them, the police are going to go to them and break them up. So that's not our problem with the business community that these are going on. So that's not something we can really handle unless we find out about them. So that's one thing. I'm talking about what you and the other ethnic restaurants that have that different time zone for their business. I mean, is it that you're not going to open until 8 o'clock and then stay open until, like, where is everybody else making their money? They're making their money between, what, 5 and 6 o'clock and 11. So 6 hours or whatever, you need your 6 hours have to be maybe from 8 o'clock to whatever, or what. So I'm just saying, is there a way that we could possibly, like in work, we have shifts. Is that going to be like a shift for certain restaurants? I don't know. It's going to be a better, you know, maybe it's going to flock to your restaurant because you're still open at 12 o'clock to come in for a drink. I'm not sure. But I understand that your money-making hours are different than the other restaurants. So you need to me, be open during those times where your people to come, that your customers, your clientele is going to come in. I think that's probably what you're looking for, something like that. I don't know if that's possible. But if we did go a little, somewhat, a little, few more hours that way, maybe that could help out. The mayor's here. I mean, obviously, if that's something that could happen, I don't know if it's fair or not, but I understand that's where y'all making your money. Everybody else is making money in between the other hours, so that might be a possibility. I don't know where else to go with it. I mean, I wouldn't have a problem with it, but that, and also, the people that, we're all suffering with this, so if they're used to staying out till 3 in the morning, tough, you're gonna have to suffer too. But you're gonna have to comply to those hours and go out, and everybody makes a little sacrifice. So I don't know if we can work it that way or not. If that would work for you, I don't know. But I mean, maybe you could make something, given maybe an extra couple hours, or changing the hours you're open or whatever. I don't know what other solution there is.
Well, apparently there's a tug-of-war match going on right now. Apparently there's a tug-of-war match going on right now between us and the city. So why can't we just compromise, okay? And come
Hamilton,
to-
I don't mean to interrupt, but I don't know if the mayor was, did you want to comment on this?
Thanks, Anthony. So just a couple things. First of all, this is a good resolve. This is good conversation. And Hamilton and I had a really civil, great conversation as well the other day. I wish Chris Cooney was here because I was on a call. Every Friday I'm on a call with the SBA call. And I specifically asked him last Friday, Chris, have you got any complaints from any business owners, not just restaurant owners, business owners? He said, I haven't got any. But again, I got a petition. I spoke to Hamilton. I spoke to Mr. Angelo. A couple things, though. So Councilor Rodriguez and Councilor Cardoza had shared with me also that some businesses are not doing the right thing. They're locking the door at 11, but then they're staying open to make cash, right? And I shared this with both Mr. Angelo and Mr. Rodriguez. That's unacceptable. So we have police officers sworn to be the license commissioners, and Chief Gomes has already started last Saturday tracking those. Biggest thing as a business owner, if you lose your license, you're out of business. That's the golden ticket. I won't hesitate to pull a license if they're not abiding. Simple as that. Not to be mean, but what's fair is fair. So I just wanted to let you know a couple other things. Hamilton had mentioned about the license commission cutting the fees in half. That actually was me. I did an executive order last week to cut the fees in half for entertainment license annual fee and also for alcohol license. I also was the mayor/city council that put the outdoor dining that you guys all approved, outdoor dining, which is now in the books forever. And then I also agreed, including George's Cafe, to give temporary licenses for outdoor dining. So I'm not anti-business, I'm not anti-restaurant, but I'm for the residents of Brockton. Now, one thing I think we have to think about is how we can come up with a solution that is not going to put businesses out of business, right? But also how people aren't going to continue to die or get sick. And I said this at the school committee when the place was packed with student athletes and their parents that wanted to play sports. And I said, thank you for being here tonight, but I would hate to take a vote tonight to say, yeah, go play sports, and then a week from now I have to revoke that and pull the rug from underneath you. Same thing tonight. I think Dr. Herman's statistics are showing, unfortunately, when Rick and I go tomorrow night to the school committee, I think there's a feeling that we're going to all take a vote, 7 members and myself, to let special ed kids back in the classroom because it'll be 3 weeks yellow. But a day after tomorrow, chances are, highly likely, we're going to be back in red. So I'm welcome to talk, especially with Council Mendez. I definitely want to talk. Our female attorney solicitor is here as well. Thank you for being here, Attorney Bridges. But one thing that was mentioned tonight that was on the petition, though, is relative to the $10,000 business assistance grant, how the application is difficult. It's not a city application. The application is set by the federal government, HUD. So even if I wanted to say, hey, let's modify, I can't. The application is set by the federal government. The money is the federal government's money. Now, I also want to thank Councilor Cardoza because education is key, and we need to continue to do education. Education. I think a lot of people got complacent, and this was on a call today with Dr. Herman. About 3 weeks ago when you drove down Main Street, everybody had a mask on. I drove down today, very few people had masks on. So I think there's some complacency. So we need to figure out how we can compromise to make people sustain their businesses, that they're putting hard-earned money in so that they don't go belly up, the moms and pops, but also make sure that our community is healthy and safe. So it's a slippery slope. So all I can tell you tonight as the mayor of Brockton and as a lifelong Brocktonian and a dad and a husband and a son is that we, the elected people, school committee, city council, myself, state delegation, have to figure out how we can collaborate with open communication and thinking outside the box. Simple as that. Those are my thoughts, Madam President.
Thank you, Mayor. I know I have councilors that have questions. Councilor Monahan, were you all set? You had the floor. Are you all, did you have any
Well,
other
whatever we
questions?
do, as Mr. Mayor, and I think we're saying that right now, we want to collaborate, but I think what they need is something like yesterday. So I hope whoever you need to get together with Hamilton, the restaurant owners, and I think you better do something next week and try to get it.
I'm not to cut you off, but this is my question. I'm not anti-restaurant. This curfew was to stop outdoor and indoor parties. So my question would be this: if I say the curfew, not anti-restaurant, just the curfew as a whole, the entity, the legal entity known as the curfew, the mandatory curfew. If I say no, Thursday night, Friday night, Saturday night, there's no curfew anymore. What the heck's going to happen with the outdoor parties and the indoor parties again? It's going to go off the
I'm
charts.
saying only for restaurants.
Huh?
I would say only for
I
restaurants.
can deal with Madam Solicitor tomorrow to see if you can do that. I don't know.
I would do it for restaurants. It would be in place, but not for restaurants. That's what I'm saying. And maybe you can work some type of a way in there, because, I mean, he's right. You're going to have the businesses, especially our ethnic restaurants like George's is now and what have you. Like I said before, you're dealing with different playing fields. Everybody else is going, I'm going out 5 o'clock to go get something to eat. I'm done by 8:30 because I'm falling asleep in the booth, but that's a different story. But I'm done. I'm not going out at 11 o'clock at night. I don't care. And I know my friends do that, but that's their time they make money. So it's got to be some type of way around that so they can make their money at their little time period. So that's what I'm just saying. Maybe there's some way of working, because they're not going to make it. I think even if we gave them an extra hour, it could help, but that's still not going to be where they're making that money. That's not their
I hear what
bread
you're
and
saying.
butter.
It's
So that's
a
all I'm saying.
different
And for the curfew-wise, I'm saying except for restaurants. Maybe that'll
I'll
work.
talk to the solicitor, much like I said
I
to
don't
Mr. Rodriguez the other day. I'm happy to talk to the solicitor
Yeah.
and see if we can do it legally.
Yeah.
In terms of the vocals, having live entertainment vocal, that's not the city, that's the governor's guidelines. You can't do that. You can't have vocal. It's prohibited by the Governor Baker's guidelines. However, the other three-piece ensemble, that meets today's step 2, so that can happen. So I think, again, it gets back to understanding the governors versus the cities versus what the needs are and desires of the community.
Right, exactly. I mean, and they could have the council courts. That's not really counts as entertainment, so, I mean, that doesn't even count.
That's specially
But anyway,
banned.
okay, thank you. Thank you, Madam.
Thank you, Counselor. Counselors, I just want to remind you that I keep an order of how, when your hands go up or when you ask to speak. So I know you all want to jump in and ask questions, but usually there's a list ahead, and I just want to remind everybody of that, because I know some of you get a little edgy and like, not to mention, not you, Counselor Monahan, you didn't get edgy at all with asking your questions. Counselor Cruz, you have the floor.
Actually, and I don't have a lot other than, it's a terrible problem we're going through right now, and it's not only restaurants that are feeling the pain. You're feeling more pain, and, you know, nobody wants to be able to go out more than, I love to go out, but my wife won't even go out right now anyways, even if we change this to an indoor restaurant. Many people are worried about that, but there are people who will go. The first thing I say, well, number one, I'm a believer in you listen to the medical people. I don't have a medical degree. I'm not an epidemiologist, and I hope I even said it right. I thought they studied bugs, but I guess that's another field. But if the medical people tell me that we shouldn't be doing it, I'm a believer in, I'm here to protect the whole community, to try to protect the whole community. I want to help the restaurant owners, but not at the expense. The first thing we should be looking at is how do we get these kids back to school? We're going to lose a generation of kids. There's going to be no kids to go to restaurants in 20 years because we're going to lose a whole generation of people, of kids. The single most important thing we need to be looking at right now is how to get those numbers down. We're getting no help out of that knucklehead in Washington. I'm glad he came home today so we can tell him, please help fix this thing. But we need to get the kids back in school first. And I just don't understand how do you do a partial curfew? A curfew is enforced by the police being able to look at somebody and saying, it's 11:05, why are you out on the street? If we try to do a curfew that doesn't include restaurants for those certain times, all anybody has to say is, I just came from a restaurant, or I'm going to a restaurant. You can't be a little bit pregnant. It doesn't happen that way. The only thing we can do is if we're going to have it, it has to be across the city and it has to be enforced. Now, again, I think one of the biggest problems we have are these underground parties. We've started to finally get the police to chase these down and enforce, and if you know about them, please reach out to the police or any of us, and because those are, in my opinion, the biggest spreads in the city are coming from these kind of gatherings. But in the meantime, as bad as it is, in my opinion, picking up a couple of hours of open time, if it stretches out another 8 months instead of taking our bad medicine now and getting it done in 2 months or 3 months, none of us know how long COVID's going to go, but the idea of trying to fix it a little at a time isn't going to work, in my opinion. Every medical person that we hear on TV or our own advisor is advising us that these are the things that are working. And if they're working, we have to go with them. Again, I want to help the restaurant owners, and I want to be a restaurant patron. But more than anything, we need to get the kids back to school. And until we get these numbers down and do all the things we need to do, then we're not going to get... I hate wearing this thing. Handsome guys like me, you don't like to have a mask on. I hate sitting here with it, and only because I have my screening here do I have it off while I'm sitting. As soon as I get up, I have to have it on. I do think restaurants, even when they try to enforce the rules, and I'm going to talk about your restaurant. I haven't been in George's in quite some time. I'm talking restaurants in general. 11 to 2 in the morning, it's not a lot of meals. It's mostly people socializing, which is wonderful. I think it's a great thing to do. But it leads to the spread of what we're trying to stop right now. So I'm just, in my opinion, as bad as it is, and I know it's painful, and we've already heard of so many restaurants going out of business. I don't know how we're going to help those businesses, but the first thing we have to do is keep these numbers going down. And I mean, I don't know how we argue with it. The numbers show that it's working. And again, to what Councilor Monahan was saying, how do you do a curfew that doesn't affect the entire city? I just don't understand how you would be able to enforce it. You now are opening, if we were to do it, in my opinion, you just say there is no curfew because it would be unenforceable to do it as a partial curfew. So, thank you, that's all I have to say.
Thank you, Councilor Cruz. Councilor Lally.
Thank you, Madam Chair. I want to warn my colleagues and the folks in the audience that unless we start moving a little quicker, we are going to be in violation of the curfew ourselves. And there is an officer right outside. I want to preface this by saying that as far as I'm concerned, probably legally as well, a curfew is the mayor's call. This is not something that we can just snap our fingers and end. And there's a couple of things that I've written down. I'm going to start with the fact that I agree with Councilor Cruz in the sense that you can't have a compromise on the curfew. You either have it or you do not. Having it for this but not for that certain days. It's a really good attempt to make to find middle ground, but I'm just concerned that I don't think it would work. Sort of branching off what Councilor Monahan said, we could always explore the idea of not having a curfew, just tougher restrictions on unpermitted and unlicensed selling of alcohol, gatherings, parties, things like that. Really crack down on where the real problem is. I think a good suggestion for a compromise would be in exchange for a lifting of the curfew, in exchange for allowing businesses to operate later, especially when, like has been said, their communities really don't come out in the hours that we've prescribed. I think asking for the restaurants to put up additional signage, take additional measures, maybe have the wait staff as they approach the table warn or remind people again to wash their hands, keep the masks on until, until they're seated and things like that. I think we can find compromises for how the restaurant treats the patrons. Additional signage and additional languages. This is very tough for the elected officials, for everybody, because the best way to resolve this is to operate as one solid body, as one solid organization, and that's not what we are. We're a bunch of different individuals. We're all going our own ways. We all have our own priorities and activities, and that has sort of put a strain on things as COVID carries on. I don't believe that, we can really, we can't legislate off of what it would look like on paper, and I'm afraid that we might wander into that. But on the same end, we pay certain penalties to be members of society, so we have to walk that line. Dr. Herman, you mentioned that this might go on for another year or two, and really it is anybody's guess. We don't know. It could be done next month. They could have a cure. Whatever they gave the president might work out wonderfully for all of us. You never know. But I think that it would be much more disruptive, and again, I'm not a parent. I think it would be much more disruptive to tell kids they can go to school this month and then pull them out, and then put them back in and then pull them out, than to allow restaurants to operate a little later and then walk it back a bit. And then when things work better, we open it up a little. Again, it is a tough line to walk, but we can't make this curfew any more convoluted, or everyone's just going to ignore it, and we won't have enough officers right outside to enforce it.
We have to remember here, as United States citizens, okay, our liberties and pursuit of happiness is being toyed with right now, okay? Keep that in mind, okay? We're being treated like slaves, all of us, to be told what time to go to sleep now. You understand? We're being treated like slaves. We got to go to sleep at 11 o'clock. We can't come out the house till 6. This is slavery. This is United States of America, land of the free, home of the brave. You guys have to understand that. This is United States, not Cuba, not Amsterdam or whatever. This is a capitalist society, not socialism. It's not communism here. You guys make
Hamilton, we're dealing with this throughout the whole country, and Brockton's been hit hard. Are you a resident of the city? I don't know if you live in the city of Brockton.
Yes, but the state says what they can say, and our license says 2 o'clock.
Right.
Now we have to go to sleep at 11 o'clock. This is the point I'm trying to make. This is enslavement.
I mean, once again, I think, we're all trying to work together, and many businesses have been hit hard. I think a lot of businesses aren't even going to be able to make it through this. So working with you and the city councilors and the mayor's office, I'm hoping that we can come to some sort of, work together and hold on till we're in this all together. I mean, whether we want to or not, we're just as, we want to see our restaurants flourish. We want to see our businesses come back to life. I see business owners that aren't restaurant owners out here, but I'm sure their businesses are being hit hard as well. But I think we have to find a way to come together instead of, many people feel the same way, but I think instead of making, voicing our opinions, come together and find a solution. I think we don't have the answers, but we're trying to find them. And I know I still have a couple of counselors before we do a second round. Councilor Rodriguez, I know you had a question. You have the floor.
Thank you very much, Madam Chair. Mr. Mayor, I do support a curfew, but at the same time, I think we have to advocate for a modification in this sense, something that works for us. Because one of the issues that I'm seeing here is that this is not a statewide curfew. And what it's doing, it's selective in the sense, and it's hurting the businesses in Brockton, not necessarily the businesses that surround Brockton. For instance, I go to Cable on Friday nights, and after Cable, we leave at 10 o'clock, and we usually stop at one of these restaurants to have something to eat. But we haven't been able to do it at a local restaurant because the kitchen shuts down at 10 o'clock on Fridays now. Well, guess what we do? We get in our cars and we drive to Easton. So we're in Easton having dinner until 11, 12, or whatever, and then drive home anyhow, and then go home. So the curfew isn't working for all of us. It's hurting some folks, though. And this is why I had a conversation with Dr. Herman in terms of, I'm not saying a blanket withdrawal of the curfew, but some sort of a modification in the sense where you modify it. And I know some of the councilors said, that a partial curfew wouldn't work. I disagree. I think it would work. Not a partial curfew on a particular time, but you can do a partial curfew on a particular date, where a curfew will be enforced Sunday, Monday, Tuesday, Wednesday, Thursday, lifted a bit on Friday and Saturday, and then go back into effect on those other days. That would work because you still have a curfew in effect. You're just kind of creeping up the time on those particular days, whichever days you feel more comfortable with. Because another thing that I've noticed is, and I think what Hamilton was talking about, what's lacking here, though, too, is an end time. We can't just say, oh, there will be a curfew until the cows come home, because all we're doing is croaking the businesses in Brockton. And as I said it earlier, it's not, is it really preventing people from gathering? I'm not exactly sure that that's the case, because it's not preventing me from gathering on a Friday night, because we're still doing that, but we're just doing it elsewhere, and it's not helping the businesses locally. So what I hope that you would take into account, because I know that's your decision as the mayor, and I want to make sure that you understand that we here have no say in what goes on with the curfew. All we can do is sympathize with you and support you whichever way we can, but the call is from the administration side of things, not from the legislative side of things. And I want to make sure that you understand that. It's not that the council doesn't want to do anything, but we don't have a say other than our recommendation that we make to the mayor, in the sense when he feels that that can be adjusted somewhat. But I actually believe that the mayor will work with you, with the businesses, with these ethnic restaurants in this community, to come up with a time frame, or because, Mr. Mayor, we can actually use these same businesses to help us in the enforcement game. Because I had mentioned to you a couple days ago that there's some businesses that are a little more on the affluent side that are not abiding by the curfew and hurting these individuals, because we have police officers standing in the parking lot of these ethnic businesses waiting for 11 o'clock to strike, and yet down the street there's other businesses that are allowed to stay open.
And Council, those are the names we need.
And that's the fair process. And that's the fair process that comes back to us as, wait a minute, you understand, as Council Monahan was saying, I mean, I gave you the example that I eat after 10 o'clock on a Friday night. So as far as when you eat dinner, to my community, it doesn't really apply as it would to your community. So we need to take that into consideration, and understanding that what applies to one does not apply to the other. And then these folks are severely hurting. First of all, their numbers have been reduced greatly by the spacing within the restaurants. So they're not making what they need to make based on the numbers of people that they have in their restaurants. So what they're looking for is a possibility of expanding those hours. So instead of seeing 10 people an hour for 3 hours, they might be able to see 10 people an hour for 4 hours. So that's why I would strongly recommend that you have a serious conversation with them. Come up with something that's comparable and doable. And Dr. Herman should be able to tell them, listen, we're going to go through this particular thing until the end of October, until the end of November, until the end of December. At least they know what to expect, and they know what's coming. And perhaps they too can help us in that whole education piece that we're talking about, you know, because they can have a conversation with their, the people coming to their patrons coming to their restaurants and say, look, you guys need to leave here and go home so that you're not going into a basement somewhere and starting a party, because that actually is going to compromise and prevent us from opening the places that we need to open. Because it's not this, and I want to borrow something that Council Lally said a while ago, this thing is going to lift. And when it does lift, we want to make sure that we have something to lift for. Because if all these restaurants are knocked out of business, I think when this whole thing clears and COVID is no longer, leading the news every night, we're going to have a vacuum left by the fact that these restaurants, and I'm actually shocked that they're still in operation, to be honest with you. I know JJ's up on the north side hasn't opened since March because he basically told me it's not worth it. You know, how can I open at 10% capacity, 20% capacity? I wouldn't make any money to even pay the cook, never mind anybody else within the facility. So this thing is actually croaking the businesses. But again, since this is not a statewide curfew, if it was, I'd support it 1,000%. But it's not. It's not even a regional curfew.
No, it's a Brockton.
So it's just a Brockton thing. But if we have all these surrounding communities that are not putting a curfew into play, they're basically sucking dollars from Brockton that are hurting the businesses within our community.
I concur with you, Counselor. I mean, you and I have had these conversations. The fact that you go to eat in Easton, Brockton's losing out on the hotel meal tax, we're losing out on all that. I get it. And what I said to Mr. Rodriguez on the Zoom the other day is, he gave the examples he gave tonight, he gave that to me and to Attorney Bridges and to Attorney Bartlett and to Dr. Herman. We'll look at anything and everything. We will. But at the end of the day, what I'm very, very concerned about is on Wednesday where we're going to be. And if we're in a hard, solid red for a couple weeks, all bets are off again. So I don't want to get people's hopes up. All I can tell you is, and most of you know me, some of you don't, but most of you do, I've already asked Attorney Bridges, the city solicitor, to vet it out. I did answer some questions for you, like the vocal you can't do. That's not me, that's Governor Baker, taking up with Charlie. But I hear you, Counselor, I hear you.
And just before I go, Madam Chair, I also want to speak with my namesake, that my ancestors would beg to differ that this is like slavery, because I don't know, what do you know about slavery? I think the fact that restaurants are staying open until 11 o'clock is not exactly the same as the slavery that my folks went through. So just to keep that in mind, and I'm sure we'll get through your version of this slavery real soon with the help from our mayor that are more than capable of coming to some sort of an understanding to help your businesses out as well.
Thank you, Counselor. I know that Counselor Thompson and Cardoso also have questions, but I have a couple of questions that councilors that haven't asked any questions. So Counselor Falwell, followed by Counselor Nacastro.
At the end, I would recommend to colleagues that we postpone this 2 weeks. I don't think we should just recommend favorably and shelve it. I think we ought to find out what statistics roll in and where we are and where the mayor is with Dr. Herman and what's going on in the community. We hear this on national television all the time, but, the virus doesn't care that you like to eat at 11 o'clock at night. And I'm very sympathetic to the restaurant business. I was going to ask Mr. Rodriguez what percentage of his profit he thought came from that 11 to 2 period, but that's an unfair question because it's unless he's a numbers geek, he probably wouldn't crunch that number and be able to give it to me tonight. But I will tell you, councilors, it's a little hard for me to sit here and listen to this debate because it appears as though it's just a segment of the restaurant population that objects to what's going on. I don't see anyone here from Brack's. I don't see anyone here from Tommy Doyle's. I don't see anyone here from Chick-fil-A. If I brought in a group of people who were narrow in representing the community, I would probably be crucified as not having reached out to everyone and try to get a cross-section of the community and what they thought. With respect to enforcing the curfew, How could you prosecute somebody for violating the curfew on a Tuesday and have that person to go into court and say, but Your Honor, it's okay on Thursday, Friday, Saturday? It's just that I was out the wrong day of the week. I think that would negate the whole purpose of a curfew. And the last thing I want to say, because I guess maybe for those of us who are older, but we're arguing here about the economic well-being of restaurants. But there has been a shared sacrifice in this country. An awful lot of people have been hurt by this virus. We've had people have their loved ones pass away in a hospital because of this virus, and they couldn't be there. They couldn't hold that person's hand when they took their last breath, and here we're sitting debating about whether we should allow people to eat between 11 and 2. And I'm having a real hard time wrapping my head around that. But I will be objective. I do understand the economic disaster that has been thrust upon the country, the state, and the city. I do think we should revisit this with the mayor in 2 weeks. I'm not going to make that motion yet because other people have things to say. And I want Mr. Rodriguez to know, and everyone else, I am sympathetic to what you're going through. I don't want you to go bankrupt. I don't want you to lose your business. But I don't want to lose any more people in this city. And I really rely on Dr. Herman and the other medical people. It's not a political issue, folks. It's a public health issue. And I thank you, Madam Chair.
Thank you, Councilor. Councilor Nacastro.
Thank you. Thank you for being here, Mr. Rodriguez, and the people who have accompanied you or have come also from the restaurant industry. It's just a rotten situation. It is. People are sick. It's a behavior-driven spread. It's a shedding illness. It's not the fault of anyone in this room, and yet everyone in this room is witnessing suffering, some on the front lines more than others. Myself, I don't see how allowing businesses to be open late on Fridays, Saturdays, and Sundays, those are the busiest nights. That's when everybody lets their guard down after a few cocktails. We all know that. I don't see that as being the answer if we're trying to keep the numbers down. That's not a popular answer, but I really feel that's so. Our first priority has to be keeping people healthy, getting our children back to school, and maintaining our businesses. And I'm willing to do more looking for money from CDBG funds or whatever federal assistance is out there to get more money to shore your businesses up as we go through this. The problem is we can't set a deadline on it because it's a behavior-driven spread. How do we know what it's going to look like in November? From all the indicators, and it's more than just crystal balls, it's science, it's going to be worse in November. How is that fair to anyone to say, let's look, I think we should continue it 2 weeks. I think we should keep the conversation going. It is a problem, and we do care. We do care.
I understand that, and I somewhat agree with you. However, I'm not looking for any social welfare. I'm not looking for any handouts from the government. I just want to operate my business.
Of course you do.
You know what I mean?
I understand.
If we have to continue this and continue the dialogue for 2 weeks, I'm all for it. But I'm not going to sit here and wait for the sun to come out and give me some money. No, I want to make my money.
Of course you do.
Since I was a kid, I hustled. Okay, I was a hustler. I hustled. I got to where I am today because I worked hard, not because of welfare and anything else. Okay? Just want to make that clear. I'm not looking for any handouts.
I know.
I want to work for what I have.
Right.
And bust my tail and grow with my merits. No affirmative action, no this, no that. I want to bust my tail and be who I am today because of my past. I don't need any government, federal funding, no EIDL, no PPP. I just want to operate my business. That's all. So we can continue this dialogue. In the next 2 weeks, I'm all for it. I understand it's getting late or whatever. But, let's continue this dialogue because we have to have a goal here. We have to come to a conclusion and put this thing to bed. So
Thank you, Mr.
Rodriguez.
I'm sorry for holding this thing up.
Oh, no,
No, you did
I
not.
appreciate
this
the
is your
time.
time. This is why we're here, that
I
we're here
appreciate the
before.
time you guys giving me tonight, and hopefully we can continue this dialogue on a later day.
And I know I express, the same sentiments, we all express this, feel the same way, and you're a Brockton business, and we support our businesses, and we want to work with you, and I know the mayor's office does, as he's expressed that, he's already made some steps to try to work with you, but you have to understand that we're in such a predicament that the residents we have to figure out how we're going to protect everybody, and that's all that we're doing. Councilor Nicastro, I know, are you all set? Did you
I
have any
am.
other?
Thank you, Madam Chair. Thank you, Mr. Rodriguez.
For your time.
Councilor Ianieri.
Thank you, Madam President. And I'll be brief because I don't want to just repeat or be repetitive to what some of the things have been said here this evening, but for one who, again, has sat here for a good many years, the one thing I've always been is very positive to the business people of this city, and I will continue to do so. And I totally agree with what Mr. Rodriguez has been indicating to us this evening, and I appreciate his little preach story a little bit on how we were all like slaves. Maybe you should go to Pennsylvania Avenue and talk to somebody else that treats things a little bit differently. But I do have to say that the one thing I totally agree with, and that is the mayor of Brockton, because something that's always been close and dear to my heart has always been the years that I spent as a school committee member. And I will tell you this, that I receive different type of calls during this whole process in the last few months. I received calls from people just the other day asking me questions about when do you think that we can get our children back into school? And I think that's the issue that we all got to be fighting for, because that's the most important and most treasured thing that we need to be doing for our children of this city, let alone the parents as well. So when the mayor says that, we're in, the yellow zone, that's fine, I guess, to a point. But when he says, let's wait and see what happens 24 hours from now, and we could be in the red zone for 2 or 3 or 4 more days, well, that makes his being a chairman of the school committee tomorrow night a very difficult task, when he has to start to discuss that with the school committee members, that we can't move forward and do what we want to do to bring children back into the school buildings. And I think that's the one thing we have to really stay focused on. I understand the situation with the businesses and what they're going through, and I can understand that. There's no doubt there's been a loss of money in that business. There's going to be a continuation of a loss of money in that business, I think, even throughout the next several years, to be truthful with you. You're seeing that happen just in Boston alone, in different restaurants that are not going to be able to reopen because they just can't afford to be coming back into the circuit again. And I know people that are in the restaurant business that I've talked to, they're part of the restaurant association, they've even said that. We have some restaurants here in the city that are able to still operate. You got a lot of restaurants that have done successful in takeout over the last several months, which never thought that was going to happen. But in any case, my biggest concern is that we try to do something, and I agree with Councilor Fowler and what he's indicated, that we need to still take a look at this and digest it, not finish it off this evening. We need to take it to the other step. And but I do support the mayor and what he's trying to do here to keep us all in good health and keep us alive and keep our children able to be back into the classrooms, because that's where I have an awful fear for what's going to happen to the younger children as they continue on in these next few years, because I may not be here, and I mean that in any such way. I mean, they're the ones that are going to be our future, and I don't know how bright it's going to be for them right now. So, thank you, Madam Chair.
Thank you, Councilor Thompson.
Thank you, Madam Chairwoman, and I'll be brief. Mr. Rodriguez, I completely sympathize with you. I myself am one of the only small business owners on the City Council, so I completely understand and your desire to grow something with your own hands, to build it, it's yours, and to want that to continue on in the future. So I do sympathize with your position there. I disagree with some of the members of this council that we could not put exceptions to our curfew. There are already exceptions now. Those exceptions relate to essential personnel, so I believe we can add restaurants as an exception to the curfew. I have spoken with other small restaurants, bar restaurants in my ward. They are not here tonight. They weren't invited to be here tonight, but they do share your position of that an extension of the curfew would be a great relief to them, and that the current curfew, as it stands right now, is hurting their business. So I know it's not just affecting minority businesses or Cape Verdean businesses. It's affecting every single business in Brockton, especially when you can go to Abington, as they do. I speaking with the restaurant owners in my ward, that they're just going over to Abington and getting served over there. So it's not that they're going home, they're just going to another place. I did have one idea as to outside the box thinking. Yeah, Mr. Mayor, is it my understanding that right now heaters are not allowed in the outdoor dining areas? Are the restaurants allowed to have heaters out in their outdoor dining? They are?
Yeah.
I think a little bit would depend on the setup or makeup of the business, but there's no outright prohibition on an outdoor heater. You probably need to involve fire if there's a propane tank time.
Right.
Okay, because I believe one of the business owners I talked to state that he believed there was a prohibition to have those propane heaters, but I'll correct him if that's not the case.
I don't believe that's the case, Councilor.
Okay, so I'm glad to hear that, because his concern was, people would still enjoy outdoor dining, even in the colder weather, if there was a heater there to provide them some relief. So if we're talking about changing the curfew, maybe we keep it at outdoor dining and allow heating, allow them to enclose that outdoor dining, or something to that effect. I don't know if that would be something that the businesses would consider, but maybe that's one of those resolutions, a middle way. It's outdoors. I think the statistics or the science says less spread outdoors. If we can keep them outdoors, have a heater, maybe enclosed like in that, not necessarily walls, but that whatever materials that allows air to blow through. Maybe that's a compromise. But I just wanted to put that out there. And again, Mr. Rodriguez, I wish you tremendous success in the future. Thank you.
Thank you, Counselor. Any other questions before Counselor Cardoso close up? Counselor Cardoso.
So I'll just close this out, and I wanted to respond to something Councilor Farrell said, and Councilor Thompson mentioned it. There are a lot of folks that are complaining, a lot. Just because you see a small handful of folks here doesn't mean that other people aren't complaining and that this thing isn't affecting them as well. So it's just that in this community, people are fearful to come out and to speak out because they're labeled as troublemakers. And so I want to thank Mr. Hamilton Rodriguez for uniting ever since he took over George's Cafe. And mind you, he wanted to keep George's as it was. He wanted to maintain the history and everything else, but then a lot of councils that used to go there pulled out of George's Cafe. There was no more council courts. There was no one else going there after city council meetings or any of that. So, but he has always tried to unite the business communities in Brockton, and that's why you see some of these folks here, because otherwise they wouldn't have come out. Okay, and that's because people are fearful to speak up in this community. It's not that they don't want to, but they've been sort of trained, and that's where Hamilton's slave mentality comes in, that they have to keep quiet or they're going to get in trouble, because then people are going to start digging and looking into their taxes and looking into their business structures. Do they have this in place? Do that? Then all of a sudden, you have the fire chief going out to their establishments telling them that they don't meet this code and that code. That's why people don't speak up. So just to respond to some of the comments here, this was a great discussion, but I want you guys to understand that this is affecting a lot of people in this community. And like Councilor Rodriguez said, people are not going home, okay? They're going elsewhere. So I want you guys to understand this, and I want to commend all of you that came out today. Obrigado em estudo que vem hoje. I think it's very important for people to stand for what they believe in, and so I thank you, and I thank you, Hamilton, for trying to unite the business community. And I asked the mayor to circle back with you guys. It's all about communication, giving you, you know, some hope. We're going to reevaluate this in a couple weeks like they do on the school side. We're going to look at it in 3 weeks and then get back to you. And I think that that's where we start to, you know, compromise. So thank you very much, everybody.
Thank you, Councilor. I would just like to clear up that I have been, and I know some of my colleagues have been there since Hamilton took over, and we enjoy it, but we haven't been anywhere because of COVID, but we were very happy to see that he took over George's and kept the business moving instead of closing it down.
Madam Chairman, just point of information. So the petition that was signed, as I said to Councilor Cardozo the other day, a lot of the signatures were illegible. So I had asked Councilor Cardozo what I should do, and she said Hamilton Rodriguez would be the point person. So we had a Zoom. Hamilton and I, since I became mayor, we do a lot of text, as well as Sam Chanette, too, from the spot. So I just wanted that into the record. Thank you.
Thank you, Mayor. Councilor, did you want to make a motion, or Councilor Farwell, are you making a motion?
Madam Chair, just to, on this issue and something that Councilor Cardozo raised, when we speak as elected officials, the words have meaning. And sometimes I'm astounded at what I hear about people are fearful to come out because then their business is going to be investigated, and then this is going to happen, and that's going to happen. That did happen, allegedly, with the Lopes case.
Councilor, I really don't, let's get back to the resolve. If you want to address what Councilor Cardozo said, you could do that, and I think we need to stick to this resolve right now and not going back and
Madam Chair, you gave a lot of latitude tonight.
I did, actually, I did, and, you know, and I do it with you as well many times, so I think right now, let's stick to the resolve. Everybody knows why we were here this evening, to work with business, with the restaurant business owners. I'm also a small business owner that's been hit very hard. So this, we can all deal with, you know, we're all emotional.
Well, you don't know what I was going to say, Madam Chair. You didn't know what I was going to say.
Bringing up what councilors are saying, so I thought you were going to make a motion about, you said earlier, you had the floor, you were going to make your motion.
That's what I was going to do, but
Okay.
fine, I'll handle it another way. But I have to tell you, you allow people to go on about alleged things that go on in this community, and then when someone wants to respond, you cut them off. And I don't think that's proper. I make a motion to postpone this resolve to October 19th.
Second.
A motion's been made and properly seconded to postpone this resolve. All those in favor? All those opposed? The resolve is postponed. Thank you. Thank you for being here this evening.
Thank you, guys.
Resolve that the mayor and a representative of the law department be invited to a committee of the city council to discuss potential funding of a consultant to work with the city clerk, legislative counsel to the city council, and the law department to update and modernize city ordinances. Invited Honorable Mayor Robert Sullivan, Megan Bridges, city solicitor, Anthony Zioli, city clerk.
Good evening. I just wanted to just give you an update. I spoke to Councilor Fowler, who filed this resolve. I'm happy to work with the council relative to reviewing ordinances. What I had asked Councilor Fowler is, do we have an expectation relative to the dollar, how much that would cost, number one? Could be 50 grand, could be 75,000, I don't know. I don't know how long it would take, but I think we need to know financially what that would be. And I've already spoke to the city solicitor as well. You know, we would have to vet out, does it make sense to try to do it internally, working with the city council's attorney and the law department, or does it make sense to hire someone that does this? And if that's the case, do you hire a lawyer at an hourly rate, or do you put out an RFP through procurement with Mike Morris? So there are some variables, but I do know that the ordinances, some of them conflict, some of them outdated. I think the other thing we would need to know, and this would be a legal opinion, would be, does there anything that would need almost like a charter review? Does anything that's in the ordinances conflict with the charter, or anything that's in the ordinances that were passed by home rule? So there are some variables. I applaud Councilor Fowler for putting it forward. I don't want to speak for the city clerk or the solicitor, but I think it's long overdue, but we have to look at the dollar amount as well and timing. Thank you.
Thank you. Do you have any questions, councilors? Counselor Farwell, since this is your resolve?
Yes, I did speak with the mayor. We're way out of sequence with many of our ordinances. This would be a one-time expenditure, whatever it costs. It should be done professionally. We have so many conflicts, they're almost too many to mention. One of my favorite ordinances, which I think should be stricken, is Article 27. It deals with circuses held in tents of canvas or sailcloth. That shows you how far back some of these ordinances go. So if the mayor is on board, this can be recommended favorably, and then I would let him get together with the city solicitor, do an RFP, figure out if it's internal or we hire someone, and I would suspect this will take 6 to 9 months to get done. But once it is done, we'll be absolutely up to where we should be in the year 2020, 2021, and then it's just a matter of keeping current as we go forward from there. Thank you.
Thank you, Counselor.
Madam Chair, because there's separation of powers, right? Legislative branch is represented by Attorney Shannon Resnick. I would just give the humble suggestion that Attorney Resnick would need to be part of this as well. And also the city clerk, of course, is the keeper of the records. The ordinances are drafted by you and passed by you, and then, you know, my team adheres to the, so I think there's a lot of parameters. I'll work with Megan Bridges, with the city solicitor, I'll work with Mr. Zioli, I'll work with Shannon Resnick, but I just want to make it clear that you do have your attorney, so we need to get her into the mix as well. Thank you.
Thank you. Counselor Lally, and I know this is something we've talked about in past years, so I will give you the floor.
It is. Thank you, Madam Chair. I just wanted to say, you know, that this is a really good idea, and I commend Counselor Farwell for bringing it up. I have, you know, before COVID, I was putting something together, you know, trying to put the framework together before really going anywhere with it, where we would be relying on interns to handle a lot of this, college students, law students to come and review our ordinances, regulations, meet with department heads, members of boards, members of the city council, and establish some level of supervision to make sure that there was an actual recognized certified authority making sure that, you know, they were pointing out the right problems. I think a top to bottom check of the city is overdue. I would like to see if we can get more more people involved, like an intern kind of program. It would save the city money, and they would do the legwork that somebody else could review. It would still have the same stamp of certification on the end, but we would get it done cheaper, and we could assemble more people to do more things quicker. And that was the goal. COVID kind of screwed that up with people not going back to campuses, and with not really being able to gather in large groups. But the main point is, this is a worthwhile discussion, and I commend Councilor Farwell for bringing it up.
It's definitely needed. Mayor?
Just want to let you know, so over the summer, even though it was virtual and Zoom, we had several interns from colleges. One was from Kennedy School of Government at Harvard, one was from Harvard University, helping us vet it out. I think it's a brilliant suggestion. The Collins Institute as well at UMass Boston can help us, as well as Fred Clark, president of Bridgewater State, has already told me prior to COVID he wanted to create an internship program, and the Bears are proud, Counselor. So
some of them.
So yeah, so I think it's a good idea. I also would be a little bit cautious though, because there is, they are the laws of the city of Brockton. So to kind of review it is one thing, but we just don't want anything to be lost. If we're going to do it, make sure we do it right.
That's right. No, this would be brought up for suggestion to be screened by a city, a city employee, the council's council, and the council itself. They would not be the only body involved.
Excellent. Thank you.
Any other questions? Councilors, we have our esteemed clerk here in the gallery as well, if anybody has any questions for him. No?
Motion to recommend favorably.
Second.
A motion's been made and properly seconded. All those in favor? All those opposed? The motion carries favorably. Back to the full city council. Madam Clerk, number 8.
Resolved, whereas elected and appointed officials will periodically hold professional development sessions to discuss, evaluate, and define roles and responsibilities, goals, objectives, and to establish best practices for the orderly function of the organization to which they belong. Resolved, the City Council shall hold a professional development session on Saturday, October 24th, 2020, at a time and location to be determined by the City Clerk. The clerk shall ensure the session is duly posted in compliance with the requirements of the Massachusetts Open Meeting Law. The clerk shall develop an agenda in consultation with counselors who may offer recommendations for topics to be discussed.
Thank you. Councilors, before we move forward with this, I would just like to just remind everybody that this is something that I had been discussing and talking with many of you one-on-ones. Since I got onto the City Council, I felt that this is something we needed to do, and I had spoken with my fellow councilors about possibly doing it this fall. And the only thing I wanted to be clear is I can't support this because that date, I'm not available for October 24th, and I don't know where that date, if any of you have been asked if that date was okay, if that's a date that's set. So, Councilor Castro, are you standing?
Oh, I'm sorry, I had a cramp, but I would like to speak, yes.
Oh, sure.
Thank you, Madam Chair. At the time that I co-sponsored this, around September 14th, that October 24th date was possible. But in speaking with the clerk, as well as my co-sponsor, Councilor Farwell, October 24th date doesn't work anymore, and so we would have to choose a date. Probably in November. I'm probably thinking more like November 21st. I have talked to the clerk about this several times. I've also spoken to most of you about suggested items for us to discuss for professional development. I've been reaching out, trying to find a facilitator for us. I think I hit on somebody good. He's a past president of the Mass Municipal Association and has just retired as a town manager. So I am working steadily at this with the clerk. I don't know where he is. Again, I'd like to throw out, we could amend this to say November 21st. But I think, for many reasons, I think this is something that we need to do. I think we will all benefit from it. I would very much like to see this happen. I hope you will all support this.
Definitely, Councilor, and like I said, this is something that I think we all agree that should happen, but we seem to be working against each other, where I think we should be working together. You and I have had numerous conversations about this, and we were researching, but it seems we're going different directions where we need to come together. So maybe we should have more one-on-one conversations with our colleagues and come up with a date that everybody is in support of.
Okay. What does anybody think of November 21st?
Right now, that's fine, you're going to ask them a date right now? I think that's fine.
Point of information. Yes. Do we know, this will certainly cost some money, do we have money in the budget for this?
Not that I know of. I've asked if we have money for stuff, not that I know of.
I spoke to the clerk about it, and he said we did.
Okay. That's the first question, and then my recommendation is that you have to pick a date, and if somebody can't make it, trying to find 11 successful Saturdays could be tough. I think the council has to pick a date, and if somebody can't make it, they can't make it.
Great.
I'm sorry, I wasn't taking the floor away. It was a point of information. Thank you.
I'd like to hear from everyone.
All right. Councilor Lally.
Thank you, Madam Chair. I wanted to point out that when I got on the council, it was a lot more common for councilors to sort of get together after the meetings, and I think that had a very positive effect on the council working together, knowing each other, disagreeing professionally but agreeing personally. I still think this is a good resolve. I don't think one replaces the other, but I would suggest if that curfew ever goes away, or if we could have shorter meetings, we might want to resume that. Would it be best for Counselor Farwell or Counselor Nicastro as one of the sponsors and you as the chair and the president to work out a couple of trial dates and then ask the rest of the body through an email.
Sure, that's what I have done. I'm not sure what Councilor Nicastro has done, but I had one-on-one conversations to try to find a date in November.
I did too.
I think any date that Councilor Lally can't make, that's the one we pick.
Second.
Councilor Farwell?
Yeah, Madam Chair, the reason we file this is it's so that we would have everyone together tonight and be able to look at their calendars and pick a date, because there will be some logistics involved. Where are we going to meet? Wherever it is, it'll have to be configured appropriately. We didn't want to do this, well, I can't speak for Councilor Nicastro. I didn't want to do this on the phone behind the scenes. I don't want any open meeting law situations to develop.
So, Counselor, I don't mean to interrupt, but if you had gone on to the webinar that they offered on open meeting laws, anytime councils have a workshop or a retreat, it does not violate the open meeting law, and it doesn't have to be on the agenda, and it can be discussed, outside of the meeting. It doesn't have to follow the action. It doesn't
Madam
have to be
Chair,
done
I
in the
took the
meeting.
webinar. Thank you very much, and I
So
have my
then
certificate.
Right.
The point I was trying to make is to deliberate over whether we hold this and on a certain date and involve the entire council. In my opinion, I'm not ready to do that.
Correct.
So
And
we're
in
here tonight,
speaking-
so I would ask, is the 21st of November acceptable? Either it is or it isn't.
I mean, I don't know about everybody else, but Counselor Thompson?
I am available November 21st, so that's a good date for me.
Thanks.
Madam Chair.
Counselor Ianieri?
Thank you, if I might. Just following up on a couple of comments that Councilor Fowler mentioned, if I'm not mistaken, Councilor, I believe it has to be posted as a meeting under executive session, if I'm not mistaken, because it is a closed-door meeting.
Actually, Counselor, I don't mean to interrupt you, but I spoke with our attorney, Attorney Resnick, and it does not have to be posted. It's not a meeting. It doesn't violate any open meeting laws.
I would check that out. I believe it has to. I know when we did it on the school committee, we had to post it as a meeting. They posted it as a retreat, and you have to. Well, I'm just checking out, but I'm not available November 21st. I'm going to tell you why. Because I think we're doing this a little bit too early under the circumstances that we have facing us right now. Are we going to find a restaurants that are going to have these types of things up? Are we going to have everything the way that it should be done for Cult 19? Or is that how it's going to be? I mean, where are we going to have it?
Well, what I had planned is here in City Hall would, I'm answering, Counselor.
Oh, okay.
So when I was planning, it would be here in City Hall, in council chambers with the conference room, and we would have individual people come in and present to us or have our discussions. So this is where it would take place.
I mean, I'll say yes to November 21st, but after 17 years, I don't think I need to go to school. Thank you very much.
Sure. And we also don't, and that's the other thing, councilors, is that we cannot force any councilor to attend this. It is of your own free and will.
And I only make one other comment, that it would only be the members of the city council, because I don't think the mayor needs to be here to be involved. That's not part of the process.
That wasn't part of my
Thank you.
plan. So, so councilors, I'm not sure if you want to continue with the date as of right now. I know personally I can't answer right now. I don't have my calendar in front of me, but if it's up to, Councilor Cardoso.
So I thought this was a good idea. We talked about this right from the beginning. I thought there was some things that we needed to address as far as just respecting one another. We don't have to agree on everything. We all have different platforms and views on things, and we all have different things that we're passionate about. We don't have to agree, but we have to respect each other. So I thought that it would be good to have a retreat to talk about some of these things, to also do some diversity training, which I think we really need. The city has evolved and changed demographically, and a lot of you guys who have been here longer than me, I thought you could benefit from learning a little bit more, having some cultural competency training, having some diversity training, unconscious bias, all of that stuff that people are doing now in this climate. And there was actually funding that came out of the Lopes case, I believe, for us to have these types of trainings all over with this body, in City Hall, with fire, with police. So I thought that having a retreat would be good. I also think, as far as the time, to Councilor Neri's point, I think it's a great time because we've had a really rough year and we've gone through a lot as a city, and emotions have run high for everybody. We've been through so many things, and like tonight, you know, it's very emotional. Like I said to the mayor last week, I was elected, not appointed, and I'm very passionate about helping people as a nurse, as an activist. And when people come to me and they need help, that's what I'm here to do. And so if it bothers other people, I'm sorry. If I say things that people think aren't appropriate, well, guess what? We're in a climate of inappropriateness with our president. Every time he opens his mouth, something inappropriate comes out of his mouth. So I'm unapologetically for the people always, and I want to make that clear. So I think that this training is good, but everybody has to welcome it. You know, you have to want to do it. So if we're saying tonight, I'm available, I'm not sure, what's the point? You know, so it's either you want it or you don't want it. Because to have, like, to set this all up and go through everything you've gone through, Councilor and Councilor Madam President, and then to have 2 or 3 people show up is just pointless to me. So that's, but I'm available the 21st if everybody wants to do it.
Thank you. Councilor Rodriguez.
Thank you, Madam Chair. I have perhaps a little bit of a different take on this particular thing. We are not an agency of the city. And I know we tend to forget who we work for. And at times, I had a bit of a problem with the resolve the way it was filed, not because solely on the date that it actually had a date, and Councilor Nacastro never talked to me about a date in terms of holding this meeting, so I probably wouldn't be able to make it anyways. But at the same time, the thing that bothered me was the fact that it was left up to the clerk to make up an agenda for us, like we work for the clerk. And I wanted to make sure that we don't lose the fact that we work for the people of the city. And when I last checked, and I know Councilor Cardozo brings that up from time to time, we weren't appointed to this position. We were elected by the people in this community. And frankly, if I make a you-know-what out of myself, the only people that I'm responsible to are the voters of the city. So I'm allowed to come here and make a bleep out of myself if I wish to do so. And the only accountability that I have is to the voters of this community. And I think that's an important concept for us not to forget, that we're here on behalf of the taxpayers and the voters of this community. And whatever we decide to do in terms of, I don't want to, and I want to borrow what Councilor Iannieri said, I don't want to sit here and be told how to represent my community. Honestly, if we want to have a retreat so we can become better friends, understand each other a little bit better, and have a better concept of what we're supposed to do here, that's all well and good. But I don't want to sit here and be dictated by an expert that comes in and says, oh, you should actually hold your head this way or hold your head that way because that's what you're supposed to do. Because the only folks that I'm accountable to in this community are the voters and the people that actually elected me to come here and represent them. I don't, to the other 10 colleagues that I have on this council, I've made it very clear that we're all one vote. And that's all we have. You know, I know that some councilors in here think that they actually are the councilors speaking for every single one of us. That's not the case. We're all one vote. And our votes count the same exact way. No matter how you turn it, it's that one vote. So I want to make sure that whatever we decide to do, that it doesn't come across as we've been, as Councilor Iannieri said, we're being sent to school so that we can learn how to do our job as city councilors that we were elected to do. I think if it's going to come across as a way of us getting together so we can become a better united group, I'm all for that. But if it's some sort of where we're going to have a couple generals come in and kind of try to whip us into shape, you can count me out because I'm not coming. Again, I think I had 9,000 plus votes the last time I ran for this particular seat, and I think though I answer to those individuals, not necessarily to anybody that sits here, downstairs, or in this building, to be honest with you. So, again, I want to make sure that that's on the record, that we all have one vote. No one is superior. I don't care if you're the president of this body. The only thing you have is the gavel because you're running the meetings. But as far as duties and responsibilities, we're all equal in this particular building, and I want to make sure that it's set out there and it's on the record. Thank you, Madam.
And I agree with you, Counselor. So it's, we are all equal, and the intent of this was really kind of just to bring everybody together and to see how we can work better. That's all I think. I know that's what my goal was. Counselor Fowler.
Just to wrap up, I understand where Councilor Rodriguez is coming from. He's not answerable to any of us, nor are we answerable to each other. However, it is often nice to respect the institution you represent and to try to make it better, to understand roles and responsibilities. I think all of us, and certainly I can still benefit from that. We have people on this body that have told me, well, I don't like to criticize the police because they have a tough job. Well, part of our role is accountability. Part of our role is having department heads come in and answer questions as to how their departments are functioning. I've had another person say, well, they get embarrassed. They don't like to come in and answer questions. So if that's the understanding that you're elected to be here, but you can't ask questions because they might be embarrassing, or you can't hold the police accountable because they might be offended, then what is your role? And having someone come in who has experience in indicating how other city councils function effectively, ask the appropriate questions, monitor expenditures, hold department heads accountable, I think would be very beneficial. It's not for the mayor to come in and lecture to us or anything else. Many organizations representing sometimes stockholders, thousands of stockholders, a board will have a professional development session. That's all this is, nothing more, nothing less, not holding anyone accountable. And this is very carefully worded, again, in response to a prior comment, that the clerk shall develop an agenda in consultation with counselors who may offer recommendations for the topics to be discussed. The reason the clerk was included in this is, A, he may have some money we can use, B, he has to post the meeting if it has to be posted, and I do believe it does, because this is a preordained meeting if we do it, involving a quorum, and he has the staff to be able to make telephone calls and do the required background work to make this happen. So it's whatever the will of the council is. I would find it beneficial, but if it isn't voted favorably, it's perfectly all right with me.
Any other comments, councilors? Does anybody want to make a motion, or?
Are you still looking for a date?
I'm not sure.
I move that we vote. I move to recommend this favorably on the condition that the date and time be set by Councilors Nicastro, Council President Azak, and Councilor Farwell. Do you want to be looped in on that? All right, so the three councilors at the very least.
Second.
A motion's been made and properly seconded. All those in favor? All those opposed?
Motion to adjourn.
Before we adjourn, councilors, I just want to remind everybody that next week's city council meeting will not be on Monday, but it will be held on Tuesday, October 13th, because Monday is a holiday, it's Columbus Day. With no more business before us this evening, this meeting is adjourned.